and the team leader should be aware of them. Ask for assistance and advice early, not when the situation deteriorates. Knowledge sharing. This is a critical component of effective team performance. Team leaders should ask for good ideas for a differential diagnosis and frequently ask for observations from team members about possible oversights. Constructive intervention. Now, sometimes a team member or the team leader may correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you have to correct a colleague who is about to make a mistake, whether it's a drug, dosage, or intervention. Summarizing and reevaluation. Summarizing information out loud is a good way to maintain an ongoing record of treatment and acts as a way to reevaluate the patient's status, the interventions performed, and where the team is within the algorithm of care. This technique can also help team members respond to the patient's changing condition. Finally, all team members should display mutual respect and a professional attitude to other team members, regardless of their personal expertise or training. It's important that the team leaders speak in a friendly, controlled voice, avoiding shouting or unnecessary aggression. Not only is it important to know what to do during a mega-code event, it's as important to know how to work together as a team during the code. Reviewing how a code went not only helps individual team members perform better in subsequent codes, but may also bring system deficiencies to light. Now we'll play the Megacode resuscitation case study again. This time, as you watch, look for the key elements of effective team dynamics. Closed-loop communication, clear messages, clear roles and responsibilities, knowing one's limitations, knowledge sharing, constructive intervention, summarizing and reevaluation, and mutual respect.
The patient's gone into VFib. Start chest compressions.
Starting compressions.
Mandel, you'll be on defibrillator. Shelley, you'll be recording.
Recording.
Sam, you'll manage the airway. Dana, have you been able to establish an IV access yet?
I've tried several times, but it's failed.
Okay, let's move on to IO access, please.
Moving to IO access.
24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Charging at 200 joules. Shock ready, clear the patient. Shocking on 3. 1, 2, 3. Shocking. Shock delivered.
I have IO access now.
Great. We'll continue CPR for 2 minutes and evaluate the need for additional defibrillation. Shelley, I'll rely on you to monitor the quality of the chest compressions. Dana, you'll need to draw the drugs up before each rhythm check, so if the arrest persists, we can move quickly to drug therapy. Let's begin with 1 milligram of epinephrine.
Drawing 1 milligram epinephrine.
2 minutes.
Okay, let's analyze. Switch roles. Okay, the patient remains in VFib. The protocol for this biphasic device is escalated dosing. Let's shock again at 300 joules.
Shocking at 300 joules. Charging. Clear the patient. Shocking on 3. 1, 2, 3. Shocking. Shock delivered.
Continue CPR.
Continue compressions. 1, 2, 3.
Dana, please give 1 milligram of epinephrine.
1 milligram epinephrine. And the IO is flushed.
Great. We've given 2 shocks and given 1 milligram of epinephrine. The next medication to consider is amiodarone. Dana, please prepare 300 milligrams of amiodarone.
Drawing 300 milligrams of amiodarone.
Sam, are you getting good chest rise?
Yes, and I'm being careful not to deliver ventilations too quickly or forcefully.
Okay, great. Let's continue there.
2 minutes.
Okay, let's analyze. Switch roles. Okay, the patient is in persistent VF. Let's shock again at 360 joules.
Charging at 360 joules. Shock ready, clear the patient. Shocking on 3. 1, 2, 3. Shocking. Shock delivered.
Continue CPR.
Continuing CPR. 1, 2, 3, 4. We can give amiodarone now.
Thanks, Shelley. Dana, please give 300 milligrams of amiodarone.
Okay. 300 milligrams of amiodarone given. And the IO is flushed.
We've given 3 shocks. After the second shock, we administered 1 milligram of epinephrine, and we've just given 300 milligrams of amiodarone. Our next drug will be vasopressin. Dana, please prepare 40 units of vasopressin.
Drawing 40 units of vasopressin.
12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24,
Let's review any reversible causes by considering the H's and T's.
What about hypovolemia?
That's a good thought. We have IO access established, but no obvious signs of internal or external bleeding. Anybody else have any other suggestions?
Have we considered hypoxia?
Is the airway still patent?
Still getting a chest rise.
She came in with epigastric discomfort and symptomatic bradycardia. Have we considered coronary thrombosis?
That's a great point. Everything seems to suggest a STEMI.
2 minutes.
Okay, let's analyze, switch roles. Okay, the monitor shows sinus bradycardia. Do we have a pulse?
I don't feel a pulse.
Continue chest compressions.
Continuing chest compressions. 1, 2, 3.
Shelley, how long has it been since our last dose of epinephrine?
3 minutes.
Okay, Dana, let's go ahead and give 40 units of vasopressin.
40 units of vasopressin given. And the IO is flushed.
Mandel, your compressions are slowing down. Can you pick up the pace a bit? 2 minutes.
Let's analyze, switch roles. Okay, the monitor shows sinus tachycardia. Sam, do we have a pulse?
I can feel a rapid, weak pulse.
Okay, great. Let's initiate immediate post-cardiac arrest care. Dana, let's get a blood pressure, a complete set of vital signs, pulse ox, and labs. Mandel, let's start a 12-lead ECG, please. Can we check to see if this patient is breathing and responsive?
Ma'am, can you squeeze my fingers? She's still unresponsive.
Still not breathing.
Okay, let's insert an advanced airway and prepare for therapeutic hypothermia.
The patient's blood pressure is 82/40 with a heart rate of 130 and a rhythm of sinus tachycardia.
Okay, the patient is hypotensive. Let's start with a liter of saline. Since we've started with hypothermia, let's use cold saline for the bolus.
Okay, we'll switch out for cold saline.
Tubes in.
Okay, we've got good breath sounds. Let's establish waveform capnography. The O2 saturation is 96%.
Here's the 12 lead.
Okay, she has a STEMI. Mandel, please call the cath lab and tell them that we have a STEMI patient. PCI and hypothermia can be safely combined after cardiac arrest.
In this section of the course, we've shown you the key steps involved in the adult cardiac arrest algorithm, as well as the post-cardiac care algorithm, to promote a positive patient outcome in the event of the return of spontaneous circulation. You've also evaluated the megacode scenario with the key elements of effective team dynamics and structured team debriefing. Combining your knowledge of essential arrest skills with effective team dynamics can give your team a better chance of success with every resuscitation attempt.
Break muna before we resume next discussion. Turner syndrome. And if you have any questions, okay, just place your questions in the chat box para ma-address natin before we resume the next discussion. Okay. We just have three remaining topics, kay the ACS, acute coronary syndrome, the stroke, no? Pero yung stroke is sobrang short lang nun, kay mga 15 minutes lang. Okay, and uh, the airway management. Okay, so siguro mga 12, no, tatapos tayo. Okay, then lunch. All right? Okay. The acute coronary syndrome is the continuation of the ECG, no? Okay, but in a 12-lead ECG consideration naman. Okay, right? It's more of the considerations of the acute coronary syndrome. Okay, again, okay, there are three key causes of the circulatory compromise, no, in advanced cardiac life support. Okay, these are the dysrhythmias, the acute coronary syndrome, and stroke. Okay, so kailangan din natin itong i-discuss. Okay, right. In ACS, okay, we can immediately observe, okay, different presentations, okay, in 12-lead ECG, okay, or through 12-lead ECG, okay, so that we can refer immediately the patient to the doctor, okay, or alam natin yung pwedeng natin gawin next. Okay, all right. Okay, the acute coronary syndrome, okay, are distinct conditions, okay, are distinct conditions that are caused by a similar sequence of pathologic events and that involve temporary or permanent blockage of the coronary artery. So this has something to do, okay, with the depletion, okay, of the oxygenated blood supply, okay, in the myocardium. Okay, all right. The myocardial tissues are very sensitive to the lack of oxygen. Okay, and when the tissue die, okay, it will never, it is reversible, it is irreversible, no? Okay, so hindi na natin sila maibabalik, right? So the problem is if those tissues and muscles, okay, become infarct, okay, it will not be stimulated anymore, okay? Kaya nagkakaroon tayo ng heart failure. And the worst scenario is, okay, there will be a cardiac arrest, okay, due to the cessation of the function of the heart. Okay, so wala na nagiging pumping action si heart. Okay, so the sequence of events that occurs during an ACS results in conditions, okay, that range from myocardial ischemia, injury, and to the death of the muscle. So these events, okay, myocardial ischemia, injury, and the necrosis, okay, this progression, okay, can be observed, no, in the 12-lead ECG or through 12-lead ECG. Right? So ito din yung ginagamit ng mga doctors, okay, to diagnose, okay, the acute coronary syndrome. Okay, however, okay, by means of 12-lead ECG, okay, or the 12-lead ECG is not 100% reliable, okay, for the signs, okay, of the acute coronary syndrome. Meron pa tayong tinatawag na laboratory test, okay, to diagnose, okay, and of course the signs and symptoms pa rin. Okay, all right. Now, we have two pathologies, no? Okay, for the for the development of the acute coronary syndrome. Okay, we have the atherosclerosis and we have the arteriosclerosis. Okay, arteriosclerosis, okay, is a chronic disease of arterial system that is characterized by abnormal thickening and hardening of the blood vessel wall. Okay, while the atherosclerosis is a form of arteriosclerosis, okay, where the thickening is due to the build-up of fat-like deposits. Okay, all right. So in ACS, okay, it could be a permanent, okay, or a temporary blockage, no? All right. If there is a temporary blockage, okay, if there is an arteriosclerosis or atherosclerosis, okay, all right. So this is what is happening, okay, in our blood vessel wall. When there is atherosclerosis or arteriosclerosis, okay, there will be a narrowing of blood vessel wall. No, ito, no, okay, itong picture na to, okay, all right. When this circumference, okay, narrows down, okay, there will be no enough oxygenated blood, okay, that will flow or that will perfuse, okay, the myocardial tissue, okay, and that is the start of the acute coronary syndrome, starting with ischemia. All right, okay. When when there is a permanent blockage, okay, it could be the cause of a ruptured plaque. No? Okay? All right. When this plaque deposits ruptured, okay, uh, it will block the coronary artery, no? Okay, and the necrosis, okay, will or the injury will progress to necrosis. Okay, wala nang magko-flow na oxygenated blood, mamamatay na yung tissue. Okay? All right. When there is a temporary blockage, meron pang nakakadaan, no? Okay, na konting blood supply. Okay? All right. But in time, okay, the blood or the myocardial tissue, okay, will not be perfused enough. Okay? But when there is a permanent blockage, okay, it can be a cause of thrombus. Okay? All right? That coming from the different parts of the coronary artery. Okay? All right? When ruptured, it will block the portion, okay, of the coronary arterial system. Okay? All right. So a stable plaque deposit, no, is or cannot be ruptured. All right? Okay, the vulnerable plaque, no, can be ruptured, okay, due to its thin cap, no, of fibrous tissue. Okay, and the number one cause, okay, of the ruptured plaque deposit is the increase in the blood flow. Okay, so pag nagkakaroon ng hypertension yung patient, mag-increase ng blood flow, the plaque deposit will rupture. All right. Okay, so the rupture of the vulnerable plaque may occur, okay, after the following: extreme physical activity. Okay, when we do extreme physical activities, okay, there will be increase, no, in the blood pressure. Okay, severe emotional trauma. Okay, sexual activity, no, exposure to illicit drugs, no, exposure to cold and acute infection. All right, and usually, okay, the plaque disruption, okay, is most likely to occur at vessel bifurcation. Okay, all right. So this is the left main coronary artery. Okay, it bifurcates into two. Okay, to left descending anterior coronary artery. Okay, and circumflex artery doon sa left side. Okay, when there is a blockage, no, okay, in the bifurcation of the left coronary artery, okay, there will be a massive portion, okay, that will be affected, no? Okay, kaya ang nangyayari, okay, kung yung buong left, if the whole left ventricle, no, is affected, okay, by the necrosis, it will not pump anymore. It will not be stimulated anymore. Okay, that is the cause of the heart attack. Okay, all right. Okay, we have three categories of the acute coronary syndrome. Okay, the unstable angina, non-SC segment elevation myocardial infarction, and SC segment elevation myocardial infarction. It can be categorized by observing the presentations, okay, in the ECG or in the 12-lead ECG. Okay, all right. So now, but before that, okay, let's first talk about the angina pectoris. No. Okay, angina pectoris is chest discomfort or other related symptoms caused by myocardial ischemia. So, say ischemia pa lang, no? Okay, for the first stage, okay, of the acute coronary syndrome, which is ischemia, okay, there will be, okay, an angina pectoris. Okay, that is the reason why this is the primary, okay, sign, okay, of the acute coronary syndrome. All right, these are the descriptions, okay, of the patients pertaining to the angina pectoris. Okay, heaviness, pressing, suffocating, squeezing, strangling, constricting, bursting, burning, grip-like, band across the chest, weight not in the center of the chest, and the vice tightening around the chest. Okay, and these are the locations, the possible locations. All right. Okay, chest, whole chest, no? It can be center of the chest, radiating to or the pain is radiating to the neck. Center of the chest, no, with radiation to the shoulder, left shoulder, and left medial part, okay, of the arm. Pwede ring epigastric lang, and this is very common sa elderly adult. Okay, back pain, okay, can be a sole sign. Pwede namang walang chest pain, okay, but there the pain is radiating to the left shoulder and both medial part of the arm. Okay, or pwedeng neck lang, or pwedeng combinations. Okay? All right? So in emergency room, okay, if the patient is 40 years old and above, okay, and the patient has an abdominal pain, it is a protocol, okay, to obtain 12-lead ECG, okay, to rule out any acute coronary syndrome, right? Okay, now, the myocardial ischemia is an imbalance between the metabolic needs of the myocardium and the flow of oxygenated blood, okay? When there is narrowing of the blood vessel wall, okay, there will be an imbalance, no? Okay, there will be a decrease, no? Okay, flow of oxygenated blood into the myocardial tissue. The ischemia, okay, will develop. Okay, all right. Or kaya naman, even a prolonged vasoconstriction of the arterial coronary system can cause also ischemia. The myocardial ischemia is treatable. No, so all we need to do, okay, is to dilate the blood vessel wall, okay, through medications, okay, or through stent insertion. Okay, all right. Okay, we have what we call stable angina and unstable angina. Okay, before we categorize the unstable angina, okay, let's first differentiate the difference of the two. Stable angina, okay, is an angina pectoris, okay, with precipitating event. Okay, for example, no, you are emotionally upset, no, you exercise, no, or you are exposed to cold weather, okay, sumakit ang dibdib mo. Okay, there is a reason, okay, why you experience angina pectoris. But no, if there is no precipitating events, there is no reason, okay, bigla na lang sumakit ang dibdib mo. Okay, that is unstable angina. All right? Okay. A stable angina, okay, can be an isolated case. All right? Pwedeng nagvasoconstrict lang yung blood vessel, okay? Pwede ring depletion lang, okay, of the flow of blood into the myocardial tissue, okay, and not necessarily mean a cardiac in origin. But an unstable angina, okay, is definitely not a cardiac origin. Okay, this is an acute coronary syndrome. Okay, all right. Unstable angina is characterized by one or more of the following. Okay, all right. Symptoms that occur at rest and that is usually last for more than 20 minutes. No, okay, nagpapahinga ka lang, biglang sumakit ang dibdib mo. Okay, and constant, you are experiencing pain constant in 20-minute, no, 20-minute period. Okay, that is an unstable angina. Okay, or symptoms, okay, that are severe or of new onset, no, okay, especially within the last 2 months, or the symptoms that are increasing in duration, frequency, or both, and intensity in a patient with a history of unstable angina. Okay. The clinical presentation and the ECG findings of unstable angina and acute MI may be identical. So what we see, okay, or we can observe, different presentation, okay, through ECG, when there is an unstable angina, but okay, only, okay, if there is only an attack. Okay, kapag masakit lang ang dibdib, saka lang tayo makakakita ng presentation. Pero kapag nawala na yung sakit, nag-subside na yung sakit, wala na tayong makikitang changes or presentation in the ECG. Okay? Namaya na kung ano yung makikita natin. Alright. When the ischemia is prolonged by more than just few minutes, results in myocardial injury. Injured myocardial tissue has been cut off. Now, this time cut off na, yung blood supply, okay, or experience a severe reduction in its blood and oxygen supply. When there is a thrombus, okay, when there is a ruptured plaque deposit, okay, that travels, okay, from elsewhere, okay, that blocks the coronary arterial system, okay, that is already an injury. Okay, all right, and of course, okay, we can also, okay, observe a presentation in the ECG. All right, when the injury, okay, is not treated, it will cause infarction. Okay, infarct, okay, is a death of a muscle. Okay, all right. Infarction comes in different area, okay, or layers of the heart. Okay, it can be subendocardial, nasa loob. Okay, all right, or nasa line or transmural, okay, from inside, okay, to outside layer. Okay, pwede namang nasa gitna lang, intramural. Okay, and pwedeng subendocardial, nandoon lang sa mismong outer layer. All right, so it depends, okay, on the extent of the damage. Okay, all right. If imagine, okay, the whole left ventricle with transmural infarction, okay, a patient no, with transmural infarction at the left ventricle, okay, right, there will be a left ventricular failure, okay, or or left-sided heart failure kasi the left part of the heart will no longer be stimulated, okay, all right. But no, okay, if the infarct happens, okay, at the subendocardial, okay, or subepicardial, okay, all right, the remaining layers, okay, will be stimulated, no, okay, still, okay, so magpapump pa rin si heart. Yun nga lang, doon mag-start no, yung different complications kasi hindi na magiging maganda yung contraction ni heart. Alright? Okay, so dito na nagkakaroon ng development of different complication. Okay? Alright. Now, okay, what we should observe, no, okay, for the acute coronary syndrome is the SC segment. Okay? Alright? SC segment, okay, is measured, okay, from the end of the QRS complex, okay, to the beginning of the T wave. Okay? There's the line should be in isoelectric. Okay? Nasa along the line lang dapat siya, no? The baseline. Okay? All right. So to measure, okay, the line, okay, of the ST segment, okay, it should be aligned with this line. With the PR segment, with the PR interval. Okay? All right? So from the PR interval, okay, okay, kailangan yung mag-draw ng imaginary line papunta dito sa ST segment. Okay, kailangan align siya doon sa PR interval. Okay? All right. Otherwise, okay, if the ST segment is above the isoelectric line, we will call that as an elevation. Okay? If below naman, okay, it is a depression. Okay? All right? So what is our measurement, okay, for the elevation? If the elevation is more than 2 millimeters, no, 2 millimeters and more in height, no, that is elevation. Okay, so or 2 small squares and above, okay, that is considered to be an elevation. Okay, for the depression naman, 1 small square below, okay, is the depression. Okay, all right. Example of elevation and depression. Yeah, no. The letter A example, okay, has a normal, okay, SC segment elevation kasi the SC segment or the PR interval and the ST segment are aligned. Okay? All right. The letter B, of course, okay, we have the normal here. Okay? This is the PR interval. Okay? Aligned siya doon sa, or the ST segment is aligned with the PR interval. Okay? All right. Letter C, okay, we have an elevation here. Okay? Actually, we have peak T wave here. Okay? Sumabay yung ST segment. Okay? All right. So this is a sign of an ST segment elevation. All right? Okay. Letter D, okay? This is the PR interval. Okay? This is the ST segment elevation. This is the ST segment, kaya elevated siya. No more than 2 small squares. Okay? All right. Letter E, another elevation, another example of elevation. Nakita-kita, no, yung ST segment, okay, above 2 inches. Okay? All right. Letter F, this is a depression, no? Okay, ito, no? Bumaba, no, yung ST segment niya. Okay? Letter G, ganun din, no? This is a depression. Ayan, bababa yung ST segment. All right? Letter H, okay, the same, ST segment depression. All right? Okay, now, okay, using the 12-lead ECG, okay, we can locate, no, the part of the heart that is being infarct, okay, through group of leads, no, okay, representing different parts of the heart. Okay, you need to know this, no. Okay, para mamaya for your diagnosis. No? The leads 2, 3, and AVF can represent or can see the inferior wall. Okay, right? So if you have an SC segment elevation, okay, observe, okay, at leads 2, 3, and AVF, okay, your diagnosis would be STEMI or SC segment elevation myocardial infarction, inferior wall, right? Okay. For the leads 1, AVL, V5, and V6 naman, they can see the lateral wall. The leads V1 and V2 can see the septum or the septal wall, okay, and leads V3 and V4 can see the anterior wall, okay. There are times that there will be combination, no? V1, V2, V3, V4. Ibig sabihin, combination ng septum and anterior wall. So what will be the term? It's anteroseptal wall, okay, anteroseptal wall. All right. The if the damage is extended, okay, up to the lateral wall, okay, ang tawag natin doon is anteroseptolateral wall. Okay, anteroseptolateral wall. Okay, clear? All right? Okay. Wait lang, guys. Okay. This group of leads is called contiguous leads. Okay, right? So contiguous leads or indicative changes are significant when they are seen into anatomically contiguous leads. Okay, so for example, si 2-3 and AVF, merong elevation. Okay, that the changes are significant, but if the elevation can only be observed at only only one lead, for example sa lead 1 lang, wala kay 2 and wala kay lead saan na ba ako? For example, 2, 3 and AVF, may elevations, okay, that is significant. But if there is only one lead, okay, that has an observable presentation, for example, kay lead 2 lang merong elevation, wala si 3 and AVF, that is insignificant. So hindi natin pwedeng sabihin ACS yon. Alright? So dapat contiguous leads, all of the contiguous leads have presentation. Okay? Clear? All right. Okay, again, okay? To categorize the diagnosis of acute coronary syndrome, okay, we can have unstable angina and STEMI and STEMI. Okay? All right. Unstable angina, okay, can be categorized, okay? If there is if there are no observable presentation in the ECG, okay? But there are elevated cardiac biomarkers. Mamaya i-discuss natin yung mga biomarkers. Okay? All right. You will diagnose an NSTEMI, okay? Or STEMI muna, no? Okay, you diagnose STEMI, okay, if there are elevations. Okay? You diagnose NSTEMI if there are no elevations. Kung walang elevations, okay, ang makikita nyo, okay, are ST segment depression and or T-wave inversion. Okay? Kaya siya non-ST segment elevation. Okay? Ang meron sa kanya ay depression. Alright? So to diagnose, you have to observe the 12-lead ECG. Alright? Okay? Then you will search for elevation. Okay? For example, the 1 in AVL, okay, have elevations. Okay? Your diagnosis would be STEMI inferior wall. Okay? So the category plus the wall, right? Okay, for example naman, si 2-3 in AVF, merong elevation. Okay, your category, your diagnosis would be STEMI inferior wall. Alright? For example, si V1, V2 ang may elevation. Okay, your diagnosis would be STEMI septal wall. Alright? Okay. Kapag kay V1, V2, V3, V4, anteroseptal wall. Alright? Okay. That's how we diagnose an acute coronary syndrome. Okay? Okay. You can take a screenshot of this. Okay, para meron kayong guide, okay, for the contiguous leads. Now, same color, okay, are the contiguous leads. Okay. Another principle that you have to know is the principle of the contralateral change. Okay? All right. Kailangan palang mag-show ng video ng camera. Okay. The contralateral change, okay, are the opposite sides, okay, of the heart. Okay? So for example, no, ito si heart. Okay? Ano ba? Ganyan na lang. Okay? This is the lateral wall, okay, and this is the inferior wall. Okay? Lateral wall, 1 AVLV 5B6. Inferior wall, 2, 3 AVF. Right? Okay. If you observe elevations at leads 1 and AVL, the involved area or the involved wall, okay, is the lateral wall. Right? Okay. Expect a depression, okay, at the opposite wall, which is the inferior wall. Clear? That is called contralateral change. Okay? All right. The elevation at leads 1 and AVLB 5B6, okay, are significant. Okay? STEMI. But the depressions, okay, at leads 2, 3 and AVF are insignificant. Okay? All right? So, ibig sabihin, okay, nangyayari yun, okay, due to contralateral change, okay, brought by the opposite sides. Kapag may elevations kay dito sa lateral wall, meron depression kay inferior wall. And vice versa. Kapag merong elevation kay inferior wall, may depression kay lateral wall. Not the depression. Okay, clear? All right? You don't expect an elevation, okay, at the opposite side. Okay? Clear? Okay? So I hope maliwanag yun. No? Okay? Kasi that is an important, no, principle. Okay? Yan. Nag-unstable na ang aking net. Okay? All right. Now, let's have an example na sasagutin nyo. Okay? Okay. So I will wait for your answer. Okay, give me, okay, your diagnosis, okay, for this 12 lead ECG. Again, category, STEMI or NSTEMI plus the wall. Okay na naman? Ha? Okay, guys. Observe the presentation. No? Okay. Saan meron elevation? Yan. Alright, okay. Gian, Carlo, okay. We have STEMI inferior wall. Okay. We have STEMI inferior wall. Alright. In this example, we have STEMI inferior wall. Okay, why? Kasi we have the elevation, okay, as seen, okay, at leads to 3 and AVF. Okay, all right. Actually, the inferior wall, okay, and the lateral wall are very common. No? Okay? All right, so we have STEMI inferior wall. All right? Okay. Okay, now, yung sinabi ko kanina, kaya na contralateral change, kapag merong elevations kaysa lead to 3 and AVF, you should expect a depression at leads 1 and AVL. No, ito yon. Nakikita nyo na? Okay? There is a depression, okay? At leads 1, no? Okay, and AVL. All right? So again, these the changes, no, at leads 1 and AVL are insignificant. Okay, next. Be very careful, no? Okay, when observing the changes, no? Take note of the normal value of the elevation and the depression. Align nyo yung S segment sa PR interval. Kitang-kita dapat na yung elevation. Okay. We have anteroseptal. Ano yung anteroseptal mo? Noriza. Anong category? STEMI. Okay? Alright. In this example, okay, we have elevations at leads 1, V1, V2, V3, and V4. No? Yan, kitang-kita nyo lahat. No? Okay? Alright? Okay. So, what are the areas, no? Okay, representing the V1, V2, V3, V4. Okay, we have the anteroseptal. So, our diagnosis would be, okay, STEMI anteroseptal. Alright? Okay. Sometimes, okay, there will be a confusion, okay, at lead 3, no? Parang may depression dito, okay? Pero, okay, medyo erratic lang yung pinaka-baseline niya. So, pero kung susundin natin yung baseline, okay, from here, okay, bumaba siya. Yan, bumaba siya dito. So, ibig sabihin, align pa rin, no, yung SC segment mo. And considering the fact na 3 lang yung merong changes, yung 2 and AVF, walang significant changes. Okay? Right? So, this is a STEMI anteroseptal wall. Alright? Next. Okay, Frances, no? Okay, STEMI, lateral wall. Okay? All right. Okay, we have S segment elevations at leads 1 AVL. 1 AVL. Okay? All right. May nakita ba kayong elevation kay V5 and V6? Okay, wala, no? Okay, pero at least, no, the lead 1 and AVL, no, at least 2, okay, meron tayong elevation. Okay? All right? Okay, yes, no, Gian, no? We have STEMI lateral wall. All right? Okay. Again, no? Okay, we have an elevations at lead 1 and AVL, okay, and there are depressions at leads 2, 3, and AVF, the contralateral change. Okay, all right? Okay, now, guys, once there is a patient, no, complaining of chest discomfort, you have to obtain 12 lead ECG within 10 minutes. All right, and that is applicable in all areas, no? Okay, maybe the patient is at the ER or ICU, okay, kailangan nyo nang i-obtain ang 12-lead ECG. Then, okay, kung wala pang ROD, okay, you have to reach, okay, for the ROD and tell him or tell her na, doc, no? Okay, please come over here immediately. Okay, we have STEMI. Yan, okay, for example, we have STEMI lateral wall. Okay, magmamadali na yun. No? Okay, tapos tinanong ni ROD, Sir, bakit mo nasabi na may STEMI tayo lateral wall? Kasi there are significant changes, no, at leads 1 and AVL, okay, which is an elevation, okay, of more than 2 millimeters. No, yan, nga yung ROD nyo sa inyo, no? Okay? All right, okay? Right, that is how, okay, we diagnose an ICS, okay? And that is very, no, okay, simple, no? Okay, when we know, okay, what to search for. All right? Okay. In the 12-lead ECG, that is basic, no, and standard. Okay, we can only assess, okay, the lateral, the anteroseptal, and the inferior. Okay, right? Kasi these are the areas, okay, that are very prone, okay, to the acute coronary syndrome. Okay, if you want to check for the right, no, okay, right side of the heart. If you want to check, asan na ba yun? Yan, if you want to check the right side of the heart, okay, you have to remove, okay, the chest electrode, okay, originally, okay, attached to the left side, okay, to the right side, okay, right? So the V1 to V6, okay, label, okay, will become V1R to V6R, right? Okay, so this will be the location of the chest electrodes, okay, for the left side. No, this is V1, okay, located at the 4th ICS, right parasternal border. Okay, right? Okay, yung left, no, 4th ICS, left parasternal border. Okay, the V3, okay, must be positioned, okay, after positioning the V4, and V4 is located at the 5th ICS, mid-clavicular line. Okay? Then, saka pa lang natin midway, ilalagay si V3. Right? V5, along the V4, 5th ICS, okay, left para axillary line. No? Nasa line ng axilla. Okay? Right? Para axillary line. Yung V6 natin, okay, that is mid-axillary line. No? Nasa gitna, no, ng kilikili. All right? So, if you want to check for the right ventricular or right chest, okay, you will remove the V3 to V6, then you will position, okay, or attach, okay, to the opposite side. Okay? All right. Pero rare, no? Okay, ang right, okay, chest involvement. Okay? All right. If you want naman, okay, the posterior involvement, kasi meron tayong posterior wall, of course, okay, you have to remove, okay, the 6, okay, electrodes, no? Okay, and place posteriorly. Okay? Right. Yan, no? Along V5, V6 yan, no? 5th ICS, no? From the anterior. Okay? But the location of V7 is posterior para-axillary line. Okay? The location, okay, of the V8 is mid-scapulary line. Okay? And the position of the V9, okay, is paraspinal line. Okay? Then the V9R to V7R on the opposite side. All right? Okay. Now, the cardiac biomarkers are creatine kinase, okay, CKMB, myoglobin, and troponins, I and T. Okay? These are the enzymes released by the musculoskeletal, okay, when there is a depletion, okay, of uh, the oxygenated blood supply, or there is a trauma, okay, or there is a viral infection. Okay, the troponins I and T, okay, are specifically for the heart. No, okay, these enzymes are released after 2 hours, no, or 2 hours after the onset of the ischemia or the angina pectoris. Okay? So, a history is very important. Tatanungin niyan sa ER, no? Ano pong oras ang na sumakit yung dibdib nyo? Okay? If wala pang 2 hours, no, okay, expect na wala pang elevation. So, wag ka na magpagawa, no, ng biomarkers. Pero if the history, okay, is not known, kaya pwede kang magpagawa ng biomarkers, okay, at pag naging hindi elevated or a normal value, okay, pero there is a constant signs, okay, of angina pectoris, okay, ulitin mo yon after 2 hours. Okay? Alright? Baka kasi hindi pa time para na-release sila. Okay? Clear? Alright? So, this is specifically, okay, for the unstable angina. Okay, for example, the patient has angina pectoris, tapos biglang nawala, no? Nagpunta ng hospital, okay? Nagpa-check, no? According to the history, sumakit daw yung dibdib, the ECG will be obtained, and there will be no observable presentation or changes in the ECG. Okay? You have to check the troponins. No? Kapag elevated yung troponins, ibig sabihin, meron siyang unstable angina. Okay? Alright, so that is how we diagnose the unstable angina. No, we cannot see, okay, in the ECG. Okay, alright. Okay, the initial management of ACS, we have the bed rest in a position of Kala ko na-DC ako. Okay? Alright. We have analgesia, we have anti-ischemic, we have thrombolytics, okay, we have anti-platelet, no, and we have the fibrinolytics. Okay? Alright. Anti-ischemic therapy, okay, is the nitroglycerin. Alright? In tablet, no, sublingual, okay, can be given, okay, in a maximum of 3 tablets, okay, interval of 5 minutes. Okay? Nitroglycerin, okay, can relax the vascular smooth muscle, no, and dilates arterial and venous vascular bed. Okay? If there is unstable angina, okay, and babad ka ng nitroglycerin sa dila, okay, there is a high probability na ma-alleviate yung pain, no? Kasi ang problem natin, okay, for NSTEMI and unstable angina is just a temporary blockage. Nag-narrow lang yung vasculature. Okay, kaya kapag na-dilate natin yung vasculature, there will be enough blood, okay, that will pass through the narrowed arterial coronary system. Okay? All right. But there are times, okay, that the nitroglycerin is not enough to alleviate the pain. So we need the analgesia. Okay? All right. The potent analgesic is the morphine sulfate. Okay? We can administer 1 to 5 milligrams, okay, for unstable angina and NSTEMI. But 1 milligram, okay, for unstable angina and STEMI every 30 minutes, okay, as needed. Okay, but for STEMI, okay, for S segment elevation myocardial infarction, okay, and this is for the injury case, we have 2 to 4 milligrams, and we limit the administration or the dosage to 2 milligrams, okay, every 15-minute interval. Okay, all right. Why? Kasi the adverse effect, no, okay, lalong-lalo na kung overdose, okay, is the respiratory depression in hypotension. All right? So, mas malaking magiging problema kapag magkaroon ng respiratory depression ang pasyente. All right, beta blockers can be given, okay, to maintain the normal heart rate and to prevent, no, the development of the different dysrhythmia. Okay, all right. Having an acute coronary syndrome, okay, can have a complication of different types of dysrhythmias. Okay, kasi it has something to do with the depletion of the oxygenated blood supply in the myocardial tissue. Prevent, no, okay, the platelet clumping, no, okay, and that can form the clot, no, right? Aspirin up to 325 milligrams, okay, that is initially given, okay, in emergency room, okay, and 75 to 162 milligrams OD, right? Clopidogrel 75 milligrams per tablet, 4 tabs, no, initial dose or loading dose at emergency room, okay, and 75 milligrams at or OD, okay. Okay, glycoprotein 2B3A inhibitors, okay, ang sikat dito is Agrastat, no, okay, sa Philippines. It prevents the fibrinogen binding and platelet clamping. If the fibrinogen, okay, if the fibrin, okay, comes in contact with platelet, mas matigas yung clamping nila. Okay? All right? So mas matigas silang losawin. All right? Okay, so we have to prevent the fibrinogen, okay, binding, no, and platelet clamping. Okay? All right. Then we have the anticoagulant, okay? The heparin, okay? That is 5,000 IU, no, as loading dose, no, in emergency room. Okay? And of course, okay, we have the reperfusion therapy. Okay, pag sinabi natin reperfusion therapy, that is the administration of the fibrinolytics, no, or yung lumulusaw talaga ng bara. All right? Okay. And that is called the fibrinolytics. Okay? Fibrinolytics, okay, ayan yung mga streptokinase, no, and RTPA or recombinant tissue plasminogen activator. Yan. Okay. It dissolves the clot by altering the plasmin in the body, which then breaks down the fibrinogen and fibrin clots. Okay, pero okay, the fibrinolytics is indicated only, okay, for STEMI. Okay? Kasi si STEMI, bara. Okay? Si NSTEMI and si unstable angina, okay, partial blockage lang. So hindi niya pwedeng hindi niya nalulusaw yung part ng plaque deposit, no? Kaya hindi niya yun nalulusaw. Okay? Ang nalusaw lang niya is yung nag-travel na bara. Okay? All right? Okay. And of course, okay, we have the CABG, no, or coronary artery bypass graft surgery. Okay? And this open heart surgery, okay, where we bypass, okay, kaya coronary artery bypass graft surgery, we bypass, okay, the block. Okay? All right. For example, now this is the artery that has a blockage. Okay? We bypass, okay, this blockage, okay, by using, okay, a vessel, okay, this is saphenous vein, okay, that connected to the aorta and to the distal part, okay, of the artery that is not blocked. Okay, all right. It requires or it costs a lot. Okay, millions yan. compared sa fibrinolytics, no? Okay, and it requires rehabilitation. Okay, kaya hanggat malulusaw natin yung bara, okay, yun yung primary na ginagawa natin. Okay? All right, may questions? May questions? Okay. Let's continue with the stroke, no? Saglit lang naman yung stroke kasi the importance of stroke, the important discussion of stroke is the 8 Ds, no? Okay, or the stroke chain of survival. Okay, then after that we will have 10-minute break. Just give me a minute. Hanapin ko. Okay. These are the 8 Ds, no? Okay, of stroke chain of survival: detection, dispatch, delivery, door, data, decision, drag, and disposition. Okay. First, okay, we have to detect, no? Okay, early, okay, the signs of stroke. Okay, we have Cincinnati pre-hospital scale, okay, for stroke. Yan, okay, 3 Ds, no? Okay, drift of the arm, drooping of the face, and dysarthria or slurring of speech. Okay, all right. If you recognize, okay, any of these signs, okay, you have to activate the EMS. All right. Okay, and this is very emergency. Right. Okay. So the EMS, okay, will be dispatched. Okay. All right, and through ambulance, no. Okay. By calling 911, right? The delivery, okay, or the prompt transport of the patient to an appropriate receiving facility. Okay, appropriate receiving facility should have a neuro, okay, ICU, okay, or a stroke team. Okay, and that is tertiary hospital. Hindi pwedeng sa primary lang, okay, secondary hospital, okay, na walang stroke team, no? Kasi hindi nila ma-monitor, okay, and ma-manage yung mga patient. Okay? Especially kapag sa primary hospital na walang CT scan. Okay? Iba naman, secondary hospital, may CT scan nga, kaya ang bagal naman. Okay? Or kaya naman, kailangan mo na mag-deposit, no, for the CT scan. Okay? Alright? Okay? Sobrang bagal nun. Alright? Okay, now, upon delivery of the EMS or ambulance, okay, to the hospital, okay, the EMS provider, okay, must have or must start the history, okay, determination of the symptom onset, and the history of the medication. Okay, and of course, okay, the ambulance should aware, okay, the hospital, okay, that there is, okay, an arriving patient, no, with stroke, okay, para ma-activate na yung stroke team. Okay, all right. Upon delivery, okay, or the patient is already on the door, on the triage area or in the hospital na, okay, the target time, okay, for the evaluation of the physician is within 10 minutes only. Okay, all right. The target time, okay, for the referral, okay, to neurologic expert, no, is within 15 minutes. Okay, right? The CT scan must be 25 minutes, no, within 25 minutes. Okay. However, here in the Philippines, hindi nangyari yan. Okay, pero kapag nangyari yan sa Philippines, no, which is nangyayari sa PGH ngayon, no, actually, PGH has this study, no, okay, ongoing study, okay, regarding the treatment, okay, of the stroke, no? And according to the initial studies, okay, when they facilitated this technique, the 8Ds, and immediately give the 5-renalytics, okay, the span of time, there is a short span of time, okay, for the recovery of the patient. No? Hindi na sobrang tagal. Okay? Ibig sabihin, the recovery is very short. Alright? Hindi tulad ng kapag na-stroke ka, parang ilang taon kang paralyzed. No? Okay? Alright? Okay, of course, with the help of the rehabilitation. Okay? Alright. So the reading, okay, for the CT scan completion, okay, must be within 45 minutes, and within 60 minutes kailangan we already decided kung anong medications ang bibigay natin. Okay? All right. Okay? Basically, as we all know, okay, we have two types of stroke, no? Okay, hemorrhagic, okay, and infarct. Okay? The infarct type, okay, is or the management of the infarct type, okay, is the same with the acute coronary syndrome. Okay, we have the antiplatelet, we have the 5-renalytics, okay, we have the anticoagulant. Okay, and these managements, okay, are contraindicated pag bleed yung or pag hemorrhagic yung case natin. Okay, so before we start um, the the treatment, okay, we need, no, the CT scan. So ang nangyayari dito sa Philippines, isang araw bago magka-CT scan, 2 araw bago magka-CT scan. So hindi natin na-start yung medication. Kaya maraming, okay, namamatay or the recovery is very long. Okay? All right. 2 hours, the target time for neurosurgical availability. Let's say, for example, the patient, okay, is with hemorrhagic, no, type of stroke. Okay, within 2 hours o dapat hindi lalagpas ang 2 hours maoperahan ang pasyente. Okay? And of course, okay, the admission, okay, for the infarct type must be within 3 hours. Hindi lalagpas ang 3 hours, kailangan nasa ICU na siya. Okay? All right. Discuss natin yan. Okay, so data, okay, all of the diagnostics, no? Okay, kailangan, okay, from time to time, okay, ina-update or pinapagawa. Okay? Decision, okay, this decision of the potential therapies, no, na nabanggit na natin kanina. Okay? And the drug. All right? Okay. So again, makikita nyo dito, okay, we have the recombinant form of tissue plasminogen activator. This is the 5-renalytics, okay, that is indicated for infarct. Okay? And of course, surgery, okay, for bleed. All right? Okay, and this position, okay, the recommended area, okay, for the admittance of the patient, okay, is the intensive care unit with neurosurgical availability. All right? Okay. If these 8Ds, okay, are followed, okay, there is a great chance, okay, of the recovery of the patient and a less chance, okay, of the cardiac arrest. Okay, all right. Okay. Any question? Any question? Nah. Okay. Let's have a 10-minute break. Okay. Then we will discuss the last topic for the ACLS. Okay, which is the airway management. All right. Okay, then after that, we will have a lunch break. Okay, let's discuss the last chapter of the ACLS, the airway management. Okay. Okay. In airway management, of course, okay, we need to first consider, okay, the respiratory compromise. Okay. Again, okay, a respiratory compromise can cause different, no, complications. Okay. Isa na rito yung decrease, no, in perfusion, okay, of the myocardial tissue that can cause different dysrhythmias and acute coronary syndrome. Okay. Sa brain, it can cause infarction naman. Okay. All right. Respiratory complaints are common in patients in all ages, okay, but more of the pediatrics, no? Kaya in pediatric advanced life support, okay, we are more of the discussion of respiratory compromise and different illnesses, no? Okay, in that involves respiratory. Okay, respiratory distress, failure, and arrest, no, reflect increasing levels of severity of the respiratory compromise. So you must know the difference of the three: distress, failure, and arrest. Okay. All right. These are the signs of adequate ventilation. Okay, the ability to breathe at a regular rate and within normal limits for the patient's age. No, meron tayong different age group normal range. No, an equal rise and fall of the chest with each breath. No, kasi sometimes makaka-experience tayo ng meron lang nag-expand lang yung kanan, no, naiiwan yung kabila, no? An adequate depth of breathing, okay? The ability to speak in full sentences without pausing, no? Sometimes, no, staggered, no, okay, yung delivery, okay, of sentences nila, okay? Hindi nila natatapos due to the sometimes fatigue, no, okay, when verbalizing, no, okay, different complaints. Okay, all right. The inadequate ventilations, these are the signs of inadequate ventilation. So if you observe, okay, any of these, okay, there must be a compromised respiratory. Okay, a breathing rate that is too fast or slow, okay, for the patient's age. Abnormal breath sounds, na ano ba yung mga abnormal breath sounds or audible breath sounds natin? Okay, we have the crackles, okay, we have the stridor, okay, we have the wheezing, okay, all right. Abnormal work, no, okay, of breathing, okay, yung minsan shallow, okay, minsan mabilis, okay, hindi constant, no, okay, all right, irregular, no, okay, breathing pattern, anxious appearance, no, okay, parang they are disturbed, no, and bothered, okay, kasi hirap silang huminga, okay. Confusion and restlessness, okay, due to the decreased oxygenated blood in the brain. Depth of breathing that is usually unusually deep or shallow. Inability to speak in complete sentences. Inadequate chest wall movement and pain with breathing. All right? Okay. These are the signs of respiratory distress. Okay, mental status change, nasal flaring, failure or mottling, retraction. Okay, retraction, meron tayong tinatawag na suprasternal retraction, intercostal retraction, and substernal retraction. Okay? All right? These are the signs of use of accessory muscles. No? Okay? And hirap na huminga yung pasyente. Okay? All right. Stridor, wheezing, no, common, okay, for or as audible sounds, no, and of course tachypnea, okay, as initial, okay, response of the respiratory system, okay, for the compromise. Okay. All right. Intervention, position of comfort, okay, of course we have to support, okay, the comfort of the patient, okay, kung saan sila komportable na maposition. Okay. Oxygen, okay, is very important, no? Okay, only if the oxygen saturation is abnormal, okay, and of course pharmacological therapy. Examples, bronchodilators, no? Okay, now in the practice nowadays, no, okay, especially in this time of pandemic, okay, if the patient, okay, has a positive COVID or a known positive COVID patient, okay, there should be an intubation when there is respiratory distress. All right, para hindi na mag-create ng aerosol, no? Okay, yung gagawin nating means kay for the oxygen therapy. Okay, but for the basic, no, okay, nung wala pang COVID, okay, when the patient has respiratory failure, all right, despite okay, of the management, okay, we need to intubate the patient. Okay, that is the only time that we need to intubate the patient. Okay, all right. These are the signs of respiratory failure: agitation, irritability, confusion, and lethargy. Okay, accessory muscle use. Okay, nasal flaring, pursed lip breathing, retraction, tachypnea, with an additional, okay, from the distress, pallor, no, muffling, cyanosis. Okay, this is due to the depletion, okay, of the oxygen in the tissue, okay, or there is already a start of decreased tissue perfusion. Okay, tachycardia and bradycardia. No, intervention, suctioning, of course. No, supplemental oxygen. Okay, NPPV or non-invasive positive pressure ventilation. Okay, by the use of bag mask. Okay, and the treatment of the specific contributing or causative factors. All right. For the respiratory arrest, okay, pag sinabi natin respiratory arrest, okay, ito na yung mga walang spontaneous breathing. Okay, unresponsive. The patient may be unresponsive, no? Kasi the brain will be affected, okay, by the loss of the oxygen supply. Excuse me. No visible chest rise and no ventilatory effort and limb muscle tone. Okay, of course, okay, we need to open the airway due to the unresponsiveness of the patient. If there is a foreign body, okay, we need to remove it through forceps. Okay, nasal or oral airway insertion to help to help maintaining the open airway. Didiscuss natin yan later on, okay, as well as the suctioning. Okay, bag mask ventilation at first, okay, pero we limit now the use of bag mask ventilation for positive cases of COVID. Okay, kasi it can create no aerosol. Okay, advanced airway insertion is the most important thing to do. Okay, and of course, treatment of specific contributing and causative factors. All right. Okay. So aside from the determination, okay, of the status of the respiratory system, okay, the distress, failure, and the arrest, we need also, okay, to furtherly assess the patient through the use of device, no? Okay, devices such as the pulse oximetry and capnography. Okay, pulse oximetry, sorry about. Pulse oximetry, okay, is used, okay, to check for the fractional content of the oxygen, no, okay, in the body. Okay, all right. So it is or through the use of the portable devices pulse oximetry. All right. Okay. These are the possible indications for the continuous pulse oximetry monitoring. Patient with critical or unstable airway. All right. Okay, if there is a respiratory distress, okay, we need to constantly monitor, okay, the oxygen saturation. Okay, patient requires oxygen therapy. Okay, for the cardiovascular diseases, okay, and for the respiratory diseases, okay, we need to monitor, okay, the oxygen during the intra-hospital and inter-hospital transfer, okay, of critically ill patient. During hemodialysis, no, and patient who has a condition or who is undergoing a procedure that alters oxygen saturation, or a patient who has a condition or history that suggests a risk for significant desaturation. Okay? All right. Sometimes, okay, there are inaccuracy, okay, of the pulse oximetry readings, okay, and these are, okay, some of the considerations, okay, of these factors. Anemia, okay, the patient may not be having any difficulty of breathing or distress, okay, but the oxygen saturation is below normal, okay, that is very common in anemia. Okay, all right, but then again, okay, we need to monitor, okay, still, okay, the patient. Okay, all right, artificial acrylic nails and with dark metallic nail polish, okay, sa ER pa lang, okay, any case of the patient, okay, we need to remove the nail polish, okay, or any acrylic nails, okay, kasi it can block, no, okay, the infrared, okay, coming from the probe of the pulse oximetry. Okay, bright ambient light, no, okay, such as what we use here in the Philippines, the drop light, no, okay, if the patient is experiencing chills, no, okay, when you have to place the pulse oximetry probe at the other side of the drop light, okay, para hindi siya exposed. Right, carbon monoxide poisoning. Okay, if there is a history of carbon monoxide poisoning, okay, we do not rely, no, okay, on the pulse oximetry reading. Okay, all right, we have to immediately provide oxygen therapy. Okay, dark skin pigmentation. Okay, medications such as vasoconstriction, okay, motion artifact, yung gumagalaw yung pasyente, no, agitated yung patient, okay, it can cause motion artifact, no, and poor peripheral perfusion as a result of cardiac arrest, shock, hypotension, or hypothermia. If the patient is in cardiac arrest, please, okay, do not check for the oxygen saturation. Okay, wala kang ma-read. All right. Okay, the patient is in shock, hypotension, and in hypothermia. Okay, it is the oxygen therapy, okay, is needed, okay, for them, no, kasi we wouldn't know, no, kung tama ba, no, yung pulse oximetry reading natin. Okay, all right. So aside from the oxygen monitoring, okay, we also have carbon dioxide monitoring. Okay, through the use of capnography. Okay, this is a continuous analysis and recording of carbon dioxide concentration in respiratory gases. Okay, it enables the early recognition of hypoventilation, apnea, and airway obstruction. So ibig sabihin daw nun, okay, if the carbon dioxide, okay, is not in normal range, okay, that is an early, no, okay, sign, okay, of hypoventilation, apnea, no, and airway obstruction cases. Okay, all right, so these are the examples or the situations in which exhaled CO2 is monitored. Okay, assessment of the adequacy of ventilation in patients with altered mental status. Okay, bronchospasm, asthma, okay, COPD, anaphylaxis, okay, for the immediate recognition and assessment of the decreased perfusion. Okay, heart failure, drug overdose, stroke, shock, or circulatory compromise. Okay, confirmation of correct tracheal tube placement and continuous monitoring of tracheal tube position. Okay, in this consideration, okay, since the tracheal tube, no, okay, should be positioned, okay, into the endotracheal or into the trachea, okay, right? There should be a release, okay, of the carbon dioxide, okay, during the exchange of oxygen. Okay, so if we place a device, no, in between the tracheal tube and the bag mask or connection, okay, to the mechanical ventilator, okay, by means of this caloric capnometer, we can be able to assess for the patency, no, of the tube in place. Okay, all right, so this is a colorimetric capnometer, no, okay, this inlet, no, okay, is connected, okay, to the endotracheal tube, okay, and another inlet, no, at the top connected to the bag mask, okay, or mechanical ventilator. Okay, all right, in this small screen, okay, in this area, okay, will indicate the normal, the value of carbon dioxide released, okay, from the lungs. All right. Okay. This can monitor, okay, the patency of the tube. For example, may bara yung tube, no? So the value of the carbon dioxide is less than normal. Okay. All right. Okay. Okay, evaluation of the effectiveness of the chest compression during resuscitation. Okay, since we cannot check or we cannot monitor the oxygen saturation during resuscitation, okay, if we monitor the carbon dioxide, it is a very reliable source, okay, of the adequacy, no, and the quality, okay, of the resuscitation. Okay, kung maganda yung daw yung release, no, ng carbon dioxide, there is a quality resuscitation or CPR. Okay, Monitoring of exhaled CO2 levels in patients with suspected increased ICP and procedural sedation and anesthesia. The normal value of the carbon dioxide is 33 to 43 millimeter mercury, okay, in the capnography. Okay, in the capnography, yeah. Okay, all right. Okay. Delivery devices, okay? Daanan lang natin to, okay? Kasi alam naman natin, these are the nasal cannula, face mask, yan, mga ganyan. Okay? Right? Okay, nasal cannula, okay, can be used, okay, up to 5 liters per minute flow rate, okay, that can give an oxygen concentration of 23 to 32%, okay? And this is indicated for the uh, oxygen saturation, okay, of 90 okay, to 94%, okay, with respiratory distress. Okay. All right. Okay. If the nasal cannula, okay, is not sufficient, okay, to increase the oxygen saturation, we can use the face mask. Okay. But the face mask is primarily, okay, for below 90%, okay, oxygen saturation in respiratory distress. All right. Okay. Advantages of nasal cannula: comfortable and well tolerated by most patients kasi the tongue, no, okay, is only in contact with the nares of the patient. Do not interfere, okay, with patient, does not interfere with the patient, okay, assessment or impede patient communication with healthcare personnel. Okay, the patient can speak clearly, no, okay, when providing information. Okay, all right. No breathing of expired air. Okay, can be used with mouth breathers. No? Okay, there are patients na having difficulty maintaining the inhalation, okay, and expiration when there is a face mask. No, kaya nasal cannula ang ginagamit natin. Okay, can be used for patients who require oxygen but who cannot tolerate a non-rebreather mask. Okay, again, okay, there are patients who cannot tolerate the non-rebreather mask due to the suffocation. Okay. Okay, disadvantage can only be used in a spontaneously breathing patient. Okay, ibig sabihin nun, if the patient has no spontaneous breathing in cardiac arrest, we cannot use the nasal cannula as well as the face mask and non-rebreather mask. Okay, we should only use the non-invasive positive pressure ventilation by the use of or through the use of the bag mask ventilation. It can easily be displaced, no? Especially kung malikot yung pasyente. Nasal passages must be open. Okay, so if there is a nasal fracture, hindi natin siya pwedeng gamitin kasi it can cause drying, no, okay, of the blood, no, okay, in that fractured area. Involves drying of mucosa that may cause sinus pain. Okay, so to prevent the drying of mucosa, you have to monitor the level of the water, okay, in the bubbler, no, okay, kasi that water, okay, can humidify, okay, the air, okay, kasi dry air or dry oxygen yung from tank or from the wall or from the source. Alright? Tubing may cause skin breakdown or irritation kay dun sa upper part ng earlobe, no? Okay, so you have to always monitor the skin integrity. Okay? Deviated septum and mouth breathing may reduce FiO2 and the oxygen flow rates of more than 6 liters do not enhance the delivered oxygen concentration. Unlike the face mask, no? Okay, up to 10 liters yun. Okay? Pero ang nasal cannula hanggang 5 lang talaga. Okay? All right. Simple face mask, okay, can be used okay, up to 10 liters per minute and can give oxygen concentration of 35 to 60%. Okay, so these are the parts, okay, of the face mask. Okay, of course, the face mask itself, no, okay, yan. Okay, the nose guide, okay, kailangan sakto yan sa nose para mas sealed, no, okay, yung sides. Okay, the inlet, the oxygen inlet, okay, from the source of oxygen, okay, the strap, okay, and the exhalation ports, no? Okay, exhalation ports, okay, allows the expired air, okay, to move, no, out of the face of the out of the mask. Okay, as the patient exhale, okay, the exhaled air, okay, will move out, okay, from the mask. Okay, all right, kasi it contains carbon dioxide. Okay, all right. Advantage, of course, no, it has a higher concentration, okay, of oxygen delivered, okay, than by the nasal cannula. Okay, so this is indicated for respiratory distress patient with the oxygen saturation of below 90%. Okay, all right. Disadvantages, okay, can only be used in a spontaneously breathing patient like nasal cannula. Okay, hindi natin siya pwedeng gamitin for respiratory arrest. Okay, it is sometimes not well tolerated by severely dyspneic patient due to the suffocating feeling. It can be uncomfortable, okay, and difficult to hear the patient speaking, no? Okay, when the device is in place or during the mealtime. Okay, all right. It requires a tight face seal to prevent the leakage of oxygen. Okay, so you have to consider the size. Okay, kasi kung malaki, no, ang gamit mo, then maliit lang yung mukha ng patient, okay, it would not be sealed, no, okay, sa side. Okay, so therefore, the oxygen concentration will be decreased. Okay, side holes in the mask permit inhalation of room air. Okay, so when there is a dilution of room air, when there is a dilution of oxygen to room air, okay, the oxygen saturation will be decreased. Okay, and hanggang 10 lang talaga siya. All right. There are these are the rebreather mask. No? Okay, the only difference of the rebreather mask to simple face mask is the presence of the reservoir. Okay, all right. Ito yung reservoir niya. Okay, so from the reservoir, okay, the oxygen source, okay, will be reserved, no, okay, in the reservoir. Okay, then para mas mataas yung oxygen saturation or oxygen concentration na may inhale ng pasyente. Okay? All right. Partial rebreather mask is the same with the simple face mask. Okay? But the non-rebreather mask. The non-rebreather mask difference, okay, between the two, okay, or compared to the two is the presence of the valves. No? May valves yan. Okay? So what the valves can do is to seal the mask, no? Okay, every time the patient inhales, okay, to prevent the dilution of air from outside. Okay, kaya mas mataas yung oxygen concentration that it can be delivered, no? 60 to 80%. Okay, so this is used, okay, for the patient in respiratory failure, okay, right, or while waiting for the one who will intubate the patient. Okay, all right, the same advantage and disadvantages. Okay. Manual airway maneuvers, okay, these are the health tilt, chin lift, and the jaw thrust. Na-discuss na natin yan yesterday. So, hindi na natin yan i-discuss. Ako nang paulit-ulit. Okay, suctioning is very important kasi it can cause blockage of airway, okay, and a decreased oxygen saturation of the patient. Okay, all right. So, again, this is just a review. Okay, suctioning is performed, okay, for the following reasons: to remove the vomitous, saliva, blood, or other material from the patient's airway, to maintain patency of an artificial airway, okay, for endotracheal tube and the tracheostomy tube, okay, to improve the gas exchange by allowing air to pass through to the lower airway, and to obtain secretions, okay, for diagnosis, no, okay, such as the culture and sensitivity. Okay, all right, we have two types of suction catheters. Okay, the rigid catheter is the other one. It's also called tonsil tip or Yankauer catheters. Okay, it is angled, no? Okay, naka curve siya, no? Okay, to help with the removal of secretions from the mouth and throat. Okay, so the rigid catheter is only for the upper airway. Okay, hanggang doon lang siya sa throat ng pasyente. Okay. As you can see, mas mataba din siya. Okay, the circumference is larger than the soft catheter, okay, na ginagamit natin usually here in the Philippines. Okay, para mas madami siyang masak na secretion. Okay, all right. The soft catheter, okay, is used to clear blood or mucus from the oropharynx or nasopharynx through endotracheal tube or tracheostomy tube. Okay, so ito yung mahaba, no, na manipis. Okay, all right. This is for the lower airway only. Okay, all right. Actually, no, okay, we should not use this soft catheter okay, for upper airway. However, here in the Philippines, naging tradition na o nakagalian na, okay, ito lang yung gamit natin na suction catheter. Okay, but if you go abroad, okay, meron silang rigid catheter. Okay? All right. Again, okay, consideration for the suctioning. A suction catheter is inserted without applying suction. Okay? So to apply the suction, okay, you have to press the block, no? Okay, the inlet, no? Okay? In intermittent, no? Intermittently, okay, to produce suction. Okay, so suction is applied as the catheter is withdrawn and should not be applied for more than 10 seconds to avoid hypoxia. Okay, so 10 seconds lang, no? Okay, as you apply suction, no, okay, you withdraw, no, okay, for 10 seconds. After suctioning, reevaluate airway patency and auscultate lung sounds, okay, for the improvement, okay, or for the need for another suctioning. Document the amount, color, and consistency of any secretions that are obtained, especially the presence of the blood, okay, in lower suctioning, okay, or lower airway, okay. Airway adjuncts can be used, okay, to help the maintaining, no, the airway, okay, especially for a coma patient or unconscious patient, okay. All right. We have two types of airway, the oral airway and the nasal airway. Okay, this is an oral airway. Okay, as you can see, okay, if this is already applied, okay, the air, okay, will pass through the opening inside. Okay, all right, and due to its contour, no, naka-curve, okay, it can hold, no, okay, the back of the tongue, okay, in place, okay, all right, para hindi maging block, no, okay, doon sa airway natin, okay. All right, sizing is very important, no, kasi there are complications when we use, okay, the too short and too long, no, size, okay. So to obtain the sizing, okay, place the size of the catheter must be the size, okay, of the size or the length of the distance, okay, from the lower earlobe, okay, to the tip of the lips. Yeah, no? Okay, all right, so this will be the problem, okay, if we use too long oral airway, okay, it can the tissue here can be pushed, okay, it can block the airway. Okay? Pag too short naman, you can push the back of the tongue. It can block the airway as well. Okay? All right. And so this is how we insert. Okay, upside down first. As we rotate, okay, we introduce as we rotate to the side. Okay, and as we rotate, get the bottom. We rotate as we rotate to the bottom. All right. The nasal airway is the same with the oral airway. Okay. The only difference is that, okay, it should be inserted, okay, into the nose, okay, of the patient. Okay, kaya siya nasal airway. Okay, it also holds the back of the tongue, okay, to maintain the airway. Okay, sizing again, okay, it should be the same size, okay, of the distance, okay, from the lower earlobe to the tip of the nose. Yeah, okay, tip of the nose. Okay, all right. You have to put lubricating gel, okay, kasi this is rubberized plastic, no? Okay, so it's somehow painful to the patient. Okay, all right. Positive pressure ventilation, okay, are the introduction of air, okay, through mouth-to-mouth resuscitation and or bag mask ventilation. Okay, right. So hindi na natin i-discuss yung mouth-to-mouth resuscitation. Okay, let's focus on the bag mask ventilation. Okay, so the bag mask ventilation, okay, must be used like this. No, okay, so we use the easy technique, okay, of our hands. No, okay, this is the C position. Okay, the thumb and the finger that holds the top of the mask. No, okay, to prevent the leakage of air from the sides. Okay, the E position, the remaining E position, the middle finger, the ring finger, and the small finger, okay, that will hold the jaw, okay, that will be used to hyperextend the neck. Okay, all right. The bag must be at the side, okay, to properly squeeze the uh, portion, okay, of the bag. Okay, all right. Uh, this technique, no, is more advisable, okay, than one provider use, okay, para at least hindi mag-leak yung air. Okay, all right. So this is thinner eminence technique. Okay, all right. So we use the jaw thrust technique. Okay, yan. Makita niyo sa first picture, right? Okay, we have two providers here. The other provider, okay, will be holding the mask, no? Okay, and the other provider will be squeezing the mask. Okay, and this is more effective. Okay, all right. This must be recommended, no? Okay, in the hospital use. Okay, kasi marami na tayong um, provider doon, no? Okay. Yan. Okay, so bag mask. Wait lang guys. Okay, so these are the examples of the bag, na, okay, in different sizes. Okay, of course, for adult, for children, and for infants. Yeah, okay. Okay, advantages of the mask provides a means for delivery of an oxygen and enriched mixture to the patient that is approximately 80% to 100%. Okay, ang naibibigay niyang oxygen concentration. Can be used with spontaneously breathing patient as well as with non-breathing patient, okay, for respiratory arrest. Conveys a sense of compliance of the patient's lungs to a bag mask device operator, okay, and provides a means for immediate ventilatory support. Okay, all right. Disadvantage, okay, of course, okay, it requires practice. Okay, delivery of inadequate tidal volume sometimes, no? Kasi yung iba hindi sanay gumamit, no? Okay, so the tidal volume is less. Okay? Causes rescuers fatigue, no? Okay, kapag hindi alam gamitin, okay, and can lead to possible gastric distension. Okay, by the way guys, no? Okay, if you introduce excessive air, okay, the excess air, okay, will exit the lungs, okay, and will enter into the stomach. Now it can cause gastric distension. The problem with the gastric distension is, okay, it can push the diaphragm and the lung. It will push the diaphragm up, okay, and it will limit the lung movement. Okay, all right. So as much as possible, no? Okay, we just need to observe the minimal chest rise and fall. Okay, ayan. Okay. Okay, advanced airway is the introduction of the uh, um, the the tube, no? Okay, meron tayong dalawang advanced airway. Okay, the extraglottic airway devices. Okay, extraglottic, no? Ibig sabihin ng extraglottic airway devices. It is blindly inserted. No use of laryngoscope. Okay, all right. It can be used or it can be placed while CPR, no, okay, is in progress, thereby minimizing interruption, okay, when performing chest compression, okay, right? Kasi blindly, no, blindly lang natin siyang ini-insert, okay. All right, this is extraglottic, ibig sabihin, okay, we are expecting that the insertion is either epiglottis, no, okay, or I mean esophagus, no, okay, or above, no, the esophagus, or within the dome of the airway. All right. Okay. What are the examples of the extraglottic tube? You have the esophageal tracheal combi tube. Yan. Okay. Pag napasok natin siya, ganito ang itsura niya, no, sa epiglottis siya. Okay. All right. So this is how it works, no. Okay. We have two tubes, two openings, okay, of the tube actually. Okay. All right, this tube is directly um, relative to the exit of air here, no, at the tip, all right, and this other tube is directly relative to the open the holes, no, here, no, in between the cups, right. So when we introduce air here, the air will exit here at the holes. Therefore, since the tube is uh, inserted into the esophagus, the air will enter the trachea. All right. Another is the laryngeal, no? Tube. It also has holes, no, in between the cups, so that when we insert this in the esophagus, the exit of air will enter the lungs or the trachea here, right? Ito yung trachea natin, no? Ito yung trachea, yan. Right? So when you introduce air here, it will exit, no, in these holes, then it will enter the trachea, All right, laryngeal mass, no, this is literally the mask. Ito, when we inflate this, it masks the trachea, no? The hole, is in between the mask. Yan. So when we introduce air here, the air will exit here, to enter the trachea. Yan. So these are the extraglottic, no, tube. All right. The extraglottic tube is only temporary. All right. Once we have the timing, for the insertion of the intraglottic tube, we need to do the intubation. All right. So intraglottic airway device, is the endotracheal tube with the use of the laryngoscope. This is intended to be directly inserted into the trachea. So we need to visualize the insertion. So to visualize the insertion, we have the tracheal intubation. All right. So the tracheal intubation, is composed of the barrel that holds the battery. When connected to the blade, ito yung blade natin. It will give you a light, no? For you to visualize the trachea. All right. We have two types of blade. The straight and the curve. All right. The straight is called the Miller and the curve is called the Macintosh. We first use the Macintosh or the curve, for regular insertion. For the difficult insertion, we use the Miller. All right. This is the endotracheal tube, no? It comes in different sizes from 2.5 to 10. But for adult, we have 7, 7.5, 8 to 8.5. And the rest, yung mga bababang sizes for pedia. All right, so these are the parts, the common parts. Of course, the tube itself, the adapter, the pilot balloon, I mean the balloon cuff and the pilot balloon. The pilot balloon is where we introduce the air, to inflate the balloon cuff. All right. The use of balloon cuff is to anchor, the tube, no, in place, and to seal the trachea, to prevent the aspiration and to prevent the exit of air. All right. Yeah. No. It is sterile, no, in package. All right. Make sure you maintain the sterility. Yeah. This is a tracheal holder, that is more advisable to use, than the tape. Kasi here in the Philippines, tape lang tayo, right? So it has a hole, no, actually here, for the to give way for the suctioning, of the upper airway. All right. So these are the methods, to confirm. These are the methods to confirm the tube placement, visualizing the passage of the tracheal tube placement. okay, through the use of laryngoscope, auscultating the presence of bilateral sounds, okay, kailangan equal sila, confirming the absence of the epigastric sound, okay, through auscultation, determining the absence of the vocal sounds after the placement of the tracheal tube, okay, measuring the CO2 level, yung diniscuss natin kanina, okay, obtaining chest radiograph, no, common yan, okay, and to assess the depth, no, okay, of the intubation, and verifying tube placement with the use of esophageal detector device. This is an example of an esophageal detector device, no? This is called O-ring, okay? All right, so you have to squeeze this one, okay, and connect, no, this inlet to the endotracheal tube adapter, okay. If it goes back, okay, to its original size, nasa trachea ka kasi may nasak siyang air. But if it retains or remains squeezed, no, okay, or deflated, okay, it means nasa esophagus ka. Okay? All right. Question? Question, pwede bang mag-intubate si nurse? Yes, pwede po. No? Okay. Provided that you know your protocol. No? Okay. There are hospitals that prohibit nurses from intubating. Okay? From advanced airway management. Okay? Pero there are hospitals na they allow, okay, the nurses, especially yung mga private hospitals na secondary hospitals and primary hospitals na walang or hindi teaching hospital. Yan. Okay, so you have to know you just have to know your protocol. All right, question. It's 12:07. Okay, may question ba? Question? Okay, so kung walang question, that concludes KD ACLS. And let's have a lunch break, no? Pwede ba hanggang 12:30 lang? Hindi, 12:40. Now we will resume at 12:40. For those who are availing the phlebotomy lecture, okay? See you, no, at 12:40, okay, for the discussion of phlebotomy. All right? Miss Joy? Okay, thank you very much. Okay, see you later at 12:30. Okay? Yes, Chai. Miss Joy, okay, will discuss to you, no, kung paano yung setup, no, okay, ng exam, no. I think meron lang kayo i-click na link, no, kasama ng handouts. Yeah, no. Okay, so I will give the floor, okay, to Miss Joy to WIPAMP, okay, for further instruction for ACLS. So thank you very much. Okay. Yes, no, Phlebo na lang yung lecture natin. Okay, later. 12:40 ha. See you at 12:40. Okay, so thank you very much. Hintayin lang natin sila Miss Joy, no, for further instruction. Okay, thank you very much. No? Nag-enjoy ako sa ECG, no? Okay, sa inyo guys, no? Kasi constantly sumasagot kayo. Okay. Okay. Yan. Ay, kanan. Okay. So thank you very much. Okay. Thank you. Okay. I hope to see you face to face, no, soon, no? Kapag wala na tong lintik na COVID na to. Okay? So thank you very much and I hope, no, marami ako na impart sa inyo na principles kay of ACLS. Okay, anyway, magkikita-kita pa rin naman tayo. Okay? So bye-bye. Okay? Take your lunch, na? Okay? And wait for Miss Joy. Okay? Thank you.
Yung kasama na and yung certs and IDs. Yes, Ma'am Rita, pwede po kayong sumali po ulit sa next training schedule. Kung follow nyo lang po yung page namin po, basta nag-register kayo sa amin kahit ilang months kayo pa kayo mag-sit in, mag-chat, mag-approach lang po kayo sa admin para mabigyan po kayo ng link. Gaya po ni Sir Gian Carlo. Last training to si Sir nag-attend, pero nag-attend pa rin siya ngayon. Pwede po kayo, welcome po kayo mag-attend ulit. Yung instructors naman po natin, paiba-iba. So, kung gusto niyo po mag-attend, pwede po, wala pong problema. No additional fee po tayo pag nag-enroll na kayo sa amin. Unless gusto niyo po ulit mag-request ng certificate sa date na yon. And kapag naman po, okay na, tapos nagka-classroom based na po tayo, pwede po kayong mag-attend classroom-based training, pero may additional, dun po na lang kami maghihingi ng additional fee para po sa venue and sa food. Yan. Sir Gian, di ba po nag-attend ka na before ng BLS? Ito ata Sir nag-attend ng BLS tapos nag-ACLS ulit. Ma'am Rialyn may CPD po ba tayo, ma'am? Yung training po natin, ma'am, wala pong CPD. Ang meron po namin CPD is nursing seminars po. IVT, refresher, tapos mga nursing seminars. Pwede po tayong mag-schedule ng mayroong CPD units, pero matagal po kasi yung scheduling nun, inaabot po ng 4 months. Sa mga nagre-request po na mga institution like hospital, school, nag-i-in-house po kami sa kanila. na may CPD, pero ini-schedule po namin yun for 3 to 4 months prior. Kahit po yung mga IVT refresher namin po, nag-a-accept po kami ngayon, pero in-house lang muna po kasi sa application pa lang po medyo pricey na. Hindi siya kakayanin ng ng fees. So yung mga nag-a-attend po ngayon sa online namin na walang CPD, ginagamit po nila to sa accreditation nila sa hospital, tapos sa application. Sa DOH accreditation, ginagamit po nila to, tapos pa nag-a-apply sila abroad. Pero kung magre-renew po kayo ng PRC nyo, hindi nyo po ito magagamit kasi wala po itong CPD. Anyway, advice naman po kayo ng mga coordinators nyo na walang CPD yung training po natin ngayon. Sige po, kung nakopy nyo na po yung link ng exam, pwede na po kayong mag-lunch break muna po dun sa mag-a-attend ng phlebotomy. Please be back po at 12:40 p.m. Enjoy your lunch po.
Two years into my marriage, I found out that my husband had a mistress. And the dreams that you really do come true. Someday I wish your eyes still and wake up while the clouds are far behind me. Which was my life. And wake up where the clouds are far behind me. Like walls feel like that you need just that's where you know you're in the morning sun. I feel you touch me in the pouring rain. You walk around me. I wanna feel you in my arms again. You come to me on a summer breeze, keep me warm in your love, and then softly breathe. And that's me to show how deep is your to learn. Cause breaking when I believe in you. You know the door to my very soul. You're the you, you're my second when you know down inside there. And it's me you need to show. Show how it is. When they
Yung joke ko kasi pang matalinong tao. So pag hindi sila natatawa, alam na nila kung asan sila ron. My name is Benji Paras, former professional basketball player and now an actor.
I'm Kobe Paras. I'm a student athlete and I go to the University of the Philippines. I don't really have that much today. I got to spend a lot of time with him.
Okay, good afternoon guys. Okay, we meet again. So konti na lang kayo. 1, 2, 3, 4. Okay? Okay. um, Welcome again, okay, to our lecture or Zoom lecture okay, for the phlebotomy. Okay, again, my name is Rowell Kula, one of the instructors okay, of WIPAM okay, for the BLS and ACLS and other programs. Okay, all right. The basic phlebotomy training, okay, supposedly have a face-to-face, no? Okay, kasi there are a lot of return demonstration, no? Okay, it would be fun, no? Okay, sana kung meron tayong return demonstration. So yun nga, no? Okay, just um, uh, as much as we want to, hindi natin pwedeng gawin muna, okay? Kasi baka mabatas tayo ng ITAC. Okay. All right. So, all right. So this is all about okay, the considerations okay, for the blood extraction. Okay, and of course, okay, the other considerations for the common complications and first aid okay, for the phlebotomy. Okay, it has also the basics okay, of bloodborne pathogen. Okay, parang infection prevention and control na rin. Okay, pero slight lang natin i-discuss. Okay. All right. I hope my audio okay is okay, no? Okay, para at least ma intindihan niyo yung mga sinasabi ko. Okay? All right. Now let's start the discussion. Okay? Okay. Disclosure lang okay for the reference okay, of this lecture okay the some parts of the content okay, came from the World Health Organization, okay, the Safety Injection Global Network sign site of World Health Organization. Okay, there is a page, no, okay, sa site nila na it contains the the standards, no, okay, the standard practices okay, for the injection, okay, and the blood extraction, okay. So I asked their permission okay, to use this for lecture here in the Philippines and they granted me naman. Okay, all right. And other books no, okay, of phlebotomy no, okay, from Infusion Nurses Society. Okay, now objectives okay, for this lecture case is to improve knowledge and awareness of these, okay, increase safe practices and reduce bloodborne virus and our virus exposure and transmission and improve patient confidence and comfort and improve of course the quality of the laboratory tests. Okay, target audience of course okay, the people who perform or supervise phlebotomy not only for med techs no, but for nurses or other healthcare providers okay, that are assigned okay, for the blood extraction. Health trainers and educators okay, and procurement officials okay, kasi we have a different engineering materials no, na that they have to consider. Okay, all right, okay. So to begin with, okay, the phlebotomy okay, as per Merriam-Webster Dictionary is the letting of blood for transfusion, diagnosis or experiment, and especially for treatment of disease. Okay, so for the letting of blood, okay, so all means okay, of extracting blood, okay, maybe it through the vein or the artery. Okay, for the diagnosis, of course, for the laboratory test, for the experiment, okay, and for the especially for the treatment of disease, just like polycythemia vera, where we bleed okay, the patient with 500 cc of blood, okay, to minimize the complication and signs and symptoms caused by the disease. Okay, all right. Phlebos, okay, means no, okay, from the Greek word vein, okay, and tone, okay, is the incision, okay. But as per today's definition of phlebotomy, okay, not only the vein okay, is involved in the blood extraction, but also the arterial extraction. So we will have a topic, no, okay, for the arterial extraction. Okay? Supposedly, okay, this will be the skills, okay, that you should acquire, okay, when we have a return demonstration. Okay? You will have a venous extraction through syringe, okay, through butterfly and evacuation technique. Okay? So tatlo na 'yon, no? Tatlo na yung extraction. Okay? Arterial extraction is the next, no? Okay, so apat na extraction. Okay? If we are partnered, okay, with the Red Cross, no? Okay, bleeding technique naman for the blood donation. Okay? So 5 extraction supposedly. Okay? Kapag meron tayong face to face. Okay? But we only have lecture, no? Okay? Siguro pag after 2 to 3 years, no, na pwede na tayong magkaroon ng training, okay, doon pa lang tayo pwedeng magkaroon ng blood extraction. Okay? Capillary collection and blood smearing or peripheral smearing is for medtechs, no? Okay, for in-house, yung ginagawa namin yan. Okay? All right? Okay. Just a brief history, okay, for the phlebotomy. Okay, it was first started, okay, during the ancient Egyptian, okay, where the bleeding, okay, of the blood, okay, or blood extraction is used for riding off bad spirits and illnesses, okay, through lancet tool. Okay, so hiwain nila, okay, yung artery, okay, or yung vein ng patient, okay, then there is a significant amount, okay, of blood, okay, that will be extracted, okay, from the patient, and they believe that the bad spirits, no, causing the disease or illnesses, okay, will be casted off. Okay, until the 15th century, the 5th century BC, okay, to 1173, okay, the barbers, okay, served as a surgeon, okay, for this technique, no, okay, for this bleeding technique. Okay, they believe kasi no na kapag nagkasakit ka, okay, if you have diseases or illnesses, okay, these are caused by the evil spirits. Okay, kaya they remove, no, okay, significant amount of blood. Okay, until the present day, only the extraction and bleeding procedure will only be facilitated in the laboratory, okay, or in the hospital. But in other countries, no, in Western countries, meron sila dong parang home service, okay, blood extraction, okay, kasi marami nang matatanda doon, okay, so they cannot able to go to the hospital, okay, for the blood extraction. So the medtechs or the nurses, okay, will go to their houses, okay, for the blood extraction. All right, okay. So these are, okay, these are the background information and best practices in phlebotomy according to the WHO. Okay, planning ahead, using an appropriate location, quality control, standards for quality care for patients and health workers, including the availability of appropriate supplies and protective equipment, availability of post-exposure prophylaxis, PEP, avoidance of contaminated phlebotomy equipment, appropriate training phlebotomy, cooperation on the part of the, okay, all right, it will be discussed, no, okay, as we go along with our lecture. Okay, all right. So the planning ahead is the most important part of carrying out any procedure, and is usually done at the start of the phlebotomy session. It includes, okay, the awareness, okay, of the patient care, okay, protocol, especially in times of pandemic, no, ngayong pandemic, okay, we have a lot of PPE, okay, that should be considered. Okay, all right, the patient, no, himself or herself, no, okay, we need to also know, okay, who, no, is the patient, no, for example, no, a person with high status, no? Okay, of course, hindi ka pwedeng medyo magkamali doon. So you have to plan, okay, for the appropriate provider, okay, that should extract blood, no? Kasi kapag nagkamali ka, baka mamaya pag-initan ka, no? Okay, all right, yung mga ganyan. Using appropriate location, the phlebotomy should work in quiet, clean, well-lit area, whether working with outpatients or inpatients. Now, specifically, when the patient or when the area is a blood extraction area in the laboratory or on the bedside of the patient, okay, and you will be doing the extraction in or at a wee time, no? Okay, na medyo patay na lahat yung ilaw, okay? All right? You need, okay, to be very careful, okay? All right? You need to be assisted with a well-lit, no, environment. Okay? Kasi hindi mo pwedeng sabihing madilim kasi kaya ka nagkamali, okay? Or naging unsuccessful yung blood extraction. Okay? All right. For the quality care, okay, for patients and health workers, okay, you have to consider the availability of the appropriate supplies and protective equipment. Okay, provide hand hygiene materials. Okay, an alcohol, 70% isopropyl alcohol, okay, is enough. Okay, for the infection prevention and control. Okay, well-fitting non-sterile gloves. Okay, yes, no. Okay, every procedures that we have to do to the patient. Okay. We have to wear gloves, no? Okay? And even if medyo mahirap, no, na mag-extract ng blood, okay, when we are wearing gloves, okay, we need to still, no, consider, okay, this PPE kasi to prevent, okay, any diseases na coming from the patient, okay, from cross-contaminating to prevent the cross-contamination. Okay, single-use disposable needles and syringes or lancing devices in sufficient numbers. Okay, to ensure that each patient has a sterile needle and syringe or equivalent for each blood sampling. So any materials, okay, that we use for the phlebotomy, okay, must be one or single use, no, only. Okay, so lahat yun, no? Even the tourniquet, okay, must be single use only. Alright? Okay, make available sufficient laboratory sample tubes, okay, to prevent dangerous practices. Okay, the most important thing, okay, for the blood extraction, okay, are the needles or the syringes and the blood collection tube or the vacutainer. Okay, so we will have that separate discussion for that. Availability of post-exposure prophylaxis. Okay, your employer must have a program, okay, for post-exposure prophylaxis. Okay, this is a support service, okay, or services, okay, that assist, okay, the employees, okay, for the possible needle prick injury. Okay, avoidance of contaminated phlebotomy equipment to avoid contamination. Any common use item should be visibly cleaned before use on a patient, and a single-use item should not be reused. And even the tackle box, no, okay, or the area, okay, of the extraction, okay, should be well cleansed, no, okay, and maintained, no, okay, every shift, okay, for the prevention, okay, of any infection and accident. All right, and training in phlebotomy, okay, here in the Philippines, okay, the first school that offered the phlebotomy, okay, was the Philippine Women's University. Pero ngayon wala na yata sila nun. Okay? So the training, okay, will be acquired, no, okay, through experience in the hospital or the independent private training center. Okay? All right, but of course, okay, before you do the extraction, okay, you have to have the training, no? Hindi naman pwedeng kahit sino na lang mag-extract, right? And of course, the patient cooperation. Okay, one of the essential markers of quality of care in phlebotomy is the involvement and cooperation of the patient. Okay, it is mutually beneficial to both the healthcare worker and the patient. Okay, there should be clear information, no, either written or verbal, and should be available to each patient who undergoes phlebotomy. So, ABCBN, you must know how to discuss, okay, the procedure with the patient. Now, especially if the patient is a pedia, no, okay, or elderly adult, sila yung mga medyo mahihirap kausap. Okay? Quality of laboratory sampling, okay? These are the factors, okay, that influence the outcome of laboratory results, okay, that we will be discussing later on, okay? Knowledge of step involved in the blood collection, use of the correct gauge of hypodermic needle, so there will be recommendations for the sizes, no? Okay, and gauge of the needle, to prevent the hemolysis and other aberrant or insufficient extraction. Then the anatomical insertion site for venipuncture, okay, we will consider this later on then. The use of recommended laboratory collection tubes, okay, the different colors of the collection tubes, okay, should be considered as well. Okay, the labeling, okay, the transportation condition, okay, and methods, and the interpretation of the results for clinical management. But we will not be discussing this last part. All right. Okay, so first thing to consider is the patient identification. Okay, this is very critical, no? Okay, aspect of total quality care. It is mandatory that the phlebotomist who collects the blood specimen from the patient correctly identify the patient. Okay, because there will be a big problem, no? Okay, if the label, no? Okay, is not properly, no, given or done, no? Kasi pwedeng magkabaligtad, no, kay yung patient natin, or I mean yung sample kay from other patient, okay, and there will be a legal matter, no. Patients must be positively identified at the time the sample is drawn. Sample must be labeled at the bedside or other collection site in the presence of the patient. Okay, all right. As you label kay the collection tube, okay, you must confirm it, no, okay, with the patient. Okay? Pag naisulat mo na, papakita mo yun sa patient. Okay? To confirm, okay, further, okay, kung tama ba yung spelling ng names nila. Okay? Alright. Now, there are components, okay, for the patient identification. Okay? There are 3 components for patient's identification. The information coming from the patient, okay? The second is the wristband, and the third is the request. No, all information, okay, must be correct. No, okay, in these 3 components. Okay, all right. So when you enter the room, okay, you have to ask for the patient's name. Okay, you must not provide the name, no, and wait for the patient's confirmation. Kailangan, okay, the name must be coming from, or the information must be coming from the patient himself. Okay, after asking for the information, check the patient's wristband, okay, for verification. If the patient is able to give the full name, the wristband agrees, okay, with the patient's statement, check the requisition or the request paper. Okay, so this includes the hospital number, medical record number, room number, correct spelling the first and the last name, the sex, the middle initial, and the date of birth. Okay, though we have a standard later on, okay, for the content of the identification. Okay, we discuss natin later. All right. If there is a discrepancy between the information and the requisition of a printed label, the wristband do not perform the venipuncture until the situation has been resolved. So that is the responsibility of the nurse station, okay, to correct, no, okay, any information, okay, that that is incorrect. Okay. All right. Have a nurse familiar with the patient provide positive identification and or check to be sure patient has correct wristband. If changes are necessary, the phlebotomy should notify appropriate personnel to make these changes, and the appropriate personnel must be the nurse station. All right? Okay, now, for the patient naman, okay, who is unconscious, too young, mentally incompetent, or does not speak the language of the phlebotomist, okay, the patient is unable to state, no, his or her name. For example, unconscious nga, no, okay, or kaya naman sobrang bata. The wristband must be relied upon totally for the information, and a nurse, okay, familiar with the patient must be consulted to verify identification of the patient. Okay, have the identifying person, okay, initial the tube, no. Okay, if this is not possible, phlebotomy should get the name of the person and document that as part of the protocol of the hospital. No? A friend or a relative may identify a patient, okay, but make sure, okay, na relative talaga niya, no, okay, or alam talaga yung information, okay, kasi of course there will be a problem, no? Okay, if um, a person identifying the information gives the incorrect information. Okay? Di natin siya masisisi kasi dapat alam mo na correct yung information. Alright? Okay, the patient can be positively identified. Okay? Perform the venipuncture and label the tube according to the protocol. No? Specimen must be labeled at the time of patient collection in the presence of the patient. Okay? Tube should be initialed, okay, by the phlebotomist to provide a mechanism for identifying the person who drew the blood. Okay? There are hospitals or institutions that require the full name, okay, of the the provider. Okay? Hindi initial. Kasi pag initial, for example, ABC, yan, ganyan lang. Okay? Alright. There are institution na they prefer to write the whole name, right, for identification. Okay? If the patient can state full name or can be identified by a nurse, friend, or relative, but has no wristband, notify the nursing station or patient nurse and request that the wristband be put on the patient. Once the band is in place, perform the venipuncture and label the tubes according to established criteria. If problems or delays occur in getting the wristband on the patient, draw the blood. Okay? Do not compromise the patient care. Okay? Kasi hindi niya kasalanan. No? And then follow up with the nurse. But if we are extracting blood, okay, for cross-matching, no wristband, no extraction. Okay? Kasi very sensitive, no? Okay? Ang information for cross-matching of the blood for blood transfusion. Okay. All right. Okay, so these are the 7 criteria, okay, for the patient identification. No? Okay, correct patient name. This requires verbal confirmation of the patient again. Okay, ask the patient to spell. No? Okay, if you are having difficulty writing, no, or understanding the how it spells. No, correct date of birth. No, ask the patient to tell you. No, okay, his or her date of birth. No, and correct date of collection, okay, for documentation on the specimen, especially, okay, for the cross-matching. Kailangan yung date of collection and for the expiring saved blood, no, such as the 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 blood, okay, for coagulation factor or coagulation test, okay. All right. Correct time of collection, initials of the personnel, name of personnel actually, location of the patient. Okay, if the patient is in the ER or in the ICU, okay, we need to release, okay, the result na immediately. Okay, or kaya naman hindi na natin isasama sa rounds yung specimen nila, no? Hindi diretso na agad natin sa laboratory. And the source of specimen. Okay, kung saan nyo siya what part of the body, okay, is used, okay, for the extraction. Okay, that is specifically for microbiology or the culture and sensitivity. Okay, all right. When there is an error in collection, okay, specifically, okay, the information, okay, do not superimpose, do not erase, okay, do not apply liquid paper or correction pen. Okay, just draw a single line through the incorrect information. Replace it, okay, with correct information and the date and initial, okay, of the one, okay, who corrected the information. Okay, so parang sa nursing documentation din yan. Okay, hindi natin binubura. No? Okay, we just draw a straight line. Okay, all right, so with regards to the safety, okay, this is very important kasi we are dealing with the fluids, no? Okay, from the patient. Okay, safety is very important. Okay, and we have to consider the blood-borne pathogens. Okay, all right. Infectious microorganisms which live in the bloodstream, okay, are the blood-borne pathogens. You can be exposed to blood-borne pathogens if you are injured with a contaminated needle. Okay, depende, no? Okay, doon sa case ng pasyente. You can also be exposed if your mucous membranes, including the eyes, mouth, or the inside of your nose, come into contact with the contaminated body fluids. So it's very important for you to wear the PPE, at least the gloves and the mask or the face mask. Okay. All right. According to Occupational Safety and Health, no, Administration, okay, uh, all trainings, no, must have the OSHA standards, okay, for included in the lecture, okay, and that is the principle of the standard precaution, personal protective equipment, hand washing, and hazardous waste disposal, okay, all right, as well as the consideration for the needle stick and prevention, all right, okay. So the standard precaution is the consideration to treat all body fluids as if they were infectious. Okay? So pag sinabi natin all body fluids, lahat 'yon, no, dapat daw hindi natin matouch, no? Or if ever man na accidentally we touch, no, any fluid coming from the patient, we need to do hand washing. All right? Okay. Potentially infectious body fluids are the blood, semen, okay, vaginal secretion, peritoneal, pericardial, and pleural fluids, and saliva. Okay, the sweat and the tears are not generally considered infectious. Okay, but you wouldn't know, okay, if the fluid that you touch, no, okay, is a sweat, no, or coming from the eyes, no. Okay, basta generally speaking, if there is a wet, no, okay, or there is a fluid, no, coming from the patient, okay, we should not touch that, or we should take consideration. Okay, all right. For the personal protective equipment, okay, we have the lab coat, gloves, face mask. Okay, these are very common. These are the common, okay, PPE, no, okay, when doing the performing the phlebotomy. Okay, however, okay, not to mention, okay, the grading of the PPE now, okay, in times of pandemic. Okay, so you have to follow the protocol of your hospital. All right, hand washing, okay, is the single most important infection control measure. All right, when to wash the hand before, after, and between all patients' contact. Okay. Be sure, okay, to turn off the faucet using a paper towel, okay, and not through your hands, no, okay, to avoid contamination. Of course, okay, you have just washed your hand, then if you touch the faucet, it will be contaminated. No? Okay, so consideration for washing the hands, you have to remove the rings, stand by the sink but do not touch it, no? Okay, kahit na magdire-diretso yung tubig doon. Apply soap and rub hands together. Okay, alam nyo na yan. Yan, okay. Dry hands with a clean paper towel. This is recommended now, okay, not anymore. Okay, the cloth towel, no? Okay, kasi right after you dry your hands with paper towel, di-discard mo na agad yun eh, okay? So hindi na yun ma-reuse. Okay? All right. Hazardous waste disposal, okay? The most important material for the waste disposal in phlebotomy is the uh, sharps container, okay? All right, but take note that the sharps container must only be used, okay, for the needles, no, and sharps, no, okay, not the cotton, not the packaging, no, okay, kailangan pang sharps lang siya, okay, kasi may treatment dyan na ginagawa, no, yung kumukuha ng hazardous wastes, okay. All right, so this is an example, no, okay, of a portable, okay, sharps container, okay, marami sa bangbang yan, no, nabibili natin, okay. All right, for the needle stick, na, okay, you have to refer, okay, to your company policy, okay, for the post-exposure prophylaxis. Okay? But this is already mandated by DOLE. So pwede kayong magreklamo kung walang program na ganito ang inyong company. Okay? Okay. Okay, so do's and don'ts, okay, of the infection prevention and control, okay, for the phlebotomy. Do carry out hand hygiene. Again, do use one pair of non-sterile gloves per procedure or patient. Okay, you must not use one or single gloves. Okay, for multiple patients. For example, you're doing your rounds or kaya naman may 5 kang pasyente na nag-extra kan, kailangan one gloves, no, okay, per one patient only. Okay, do use single-use device, okay, for blood sampling and drawing. Okay, just like I've mentioned a while back, Okay, all the materials that we have to use for phlebotomy should be one use only. Do disinfect the skin at the venipuncture site. Okay, we will give emphasis, okay, for the disinfection, okay, of the skin later on. Do discard the used device, okay, immediately into a robust, okay, sharp container, okay, where a capping of a needle is unavoidable. Okay, all right, the sharp container, okay, the portable sharp container, okay, must be placed, okay, together with the, or uh, must be included in the materials in the tackle box, okay, para right after, okay, we extract blood, hindi na natin yun i-recap na diretso na agad doon sa sharps container. Okay? But if you do not have a choice, kaya recapping, no? Okay? If the recapping is necessary, okay? There is a best method pa rin, okay, for recapping, and that is the one-hand technique. Okay? Do use one-hand scoop technique, no? Okay, for recapping. Okay? Kumbaga, i-scoop mo lang yung cup, no? Okay? Using the needle. Okay? And then nakahawak ka sa plunger, sa syringe, sa barrel ng syringe mismo. Okay? Do seal the sharps container with tamper-proof lid. No? Okay? It must not leave, okay, open. Alright? Do place laboratory sample tubes in a sturdy rack, no, before injecting it into the rubber stopper. We discuss that later. Do immediately report any incident or accident linked to a needle or sharp injury and seek assistance. No? Start post-exposure prophylaxis as soon as possible. Okay? Do not forget to clean your hands. Okay? Do not use the same pair of gloves. Do not wash gloves for reuse. No araw kasi ginagawa pa yan. No? Do not use a syringe, needle, or lancet for more than one patient. Do not touch the puncture site after disinfecting it. Okay, you can touch the site. You can touch the site that you cleanse, pero it must be above, okay, the located venipuncture site. Okay. Do not leave an unprotected needle lying outside the sharps container. Okay? Hindi kung saan yun nilalagay dun sa tackle box. Do not recap a needle using both hands. It must be one hand technique. Do not overfill or decant a sharp container kasi there's a possibility of spillage. No? Do not inject into a laboratory tube while holding it with the other hand. Okay, do not delay prophylaxis after exposure to potentially contaminated material kasi beyond 72 hours, the PEP or the post-exposure prophylaxis may not become effective. Okay? All right. The location or the site of the venipuncture is also important. Okay, we need to consider the successful attempt of extraction. Okay. Okay. The three are the most common site for the venipuncture or for the blood extraction. Okay, the cephalic, sa lateral part yan, basilic sa medial part, and median sa gitna. Right? Okay, the median cubital is the most common among the three. Right? Kasi ito yung may pinakamalaki and stable na vein. Alright? Yeah, okay. So to locate the site, position the arm and apply the tourniquet. Okay? All right, the position of the arm must be the site must be towards you, no? Okay, hindi nakatagilid, no, hindi naka-prone position. Okay? All right? Cephalic vein, antecubital, basilic vein, median cubital, and also the wrist or hand veins are also acceptable. Okay? Or the metacarpal veins. Okay? So use the tip of your finger on your non-dominant hand to palpate the vein. Tip of your finger, hindi yung buong finger mo. Right? Okay. And it must be horizontal, no, or parallel, to the skin of the patient. Hindi pa ganito, no? Okay, for example, ito, no? Hindi pa ganito. Okay? Kailangan ganyan, no? Alright? Okay, the tip of your finger. Okay? Kasi pag ganyan, tatama lang dyan is yung kuko mo, it is very hard, so hindi mo masyadong makakapa, no, kasi matigas. Alright? Okay. You have to determine the size, the depth, and the direction of the vein. Okay? The size must be large enough, for the required needle. The depth, okay, kailangan as much as possible shallow, no, mababaw lang, okay, or else mahihirapan ka kung sobrang lalim, no. Direction of the vein, okay, it must be straight, okay, right? Huwag kang pipili ng nag-bifurcate, okay, or kaya naman yung parang thread like, no, yung sanga-sanga, okay. Develop your sense of touch, no, okay. Veins have bounce or resilience, artery would say, okay, okay, we don't usually palpate care for the vein, for the arteries, no, kasi medyo malalim yun. Okay. Once you have chosen a vein, okay, mentally visualize and the location and the direction of the vein, kasi as much as possible you will not touch again, okay, the site of venipuncture. All right. Site to avoid sclerose and thrombose veins. Okay, it feels hard, no, and cord-like and lack resilience. No? Pag sinabi natin sclerose or thrombose vein, okay, ito yung mga sclerotic na, no? Okay, meron ng something doon sa wall ng vein that can cause the thickening, okay, of the blood vessel. No? These veins are very hard to penetrate. No? It can roll easily, no, and may not have adequate blood flow to obtain an adequate blood sample. Okay, sites with extensive scarring can must also be avoided, and edematous area as much as possible. But if you do not have a choice, okay, edematous area, okay, is also okay, or can be used, okay, for the venipuncture. Okay, for the site with hematoma, no? Okay, hindi rin natin siya ini-injikan as much as possible kasi okay, we can introduce infection, no? Okay, the side of the mastectomy, okay? Why? Okay, lymphostasis occurs on the side of mastectomy and results in poor drainage and of fluids and may be painful for the patient. Okay? Intravenous lines, okay? We do not draw, no? Okay? The uh, blood, no, okay, on the part, no, okay, of the or with IV line, okay. But if you do not have a choice, okay, what we should do is to clamp or turn off the IV line for 20 minutes, okay. We flush with sterile water, okay, and that's the only time that we can extract blood, okay. But as much as possible, we do not draw no blood into the IV line part. Indwelling lines, no, ito yung mga merong cannula, okay, pero walang IV line, no? Okay, hindi rin tayo kumukuha doon, no? Or we do not also draw okay, blood, no, okay, in the indwelling lines. Okay? All right? But again, okay, if we do not have a choice, no, okay, merong procedure, okay, na pwede nating gawin, okay, to collect blood, no? Okay? We have to first discard 5 to 10 cc of blood, no, in the separate syringe, okay, before we collect, no, blood, okay, for the laboratory test. Okay, all right? Okay. Equipment, no? Okay, ano yung mga equipment natin? Okay, of course, we have the tray, no? Okay, this is an example of a perfect phlebotomy tray. Okay, all right? Now, as you can see in the picture, meron siyang portable, okay, small sharps container. Okay? And then, nandiyan na lahat yung materials natin. We have the collection tube, we have the tapes, no, we have the syringes, we have the lancet, okay, we have the bandage, no, okay, we even have scissors, no, okay, sometimes. All right. Tray should be sanitized daily using appropriate disinfectant. So, tatanggalin lahat yan tapos sanitize. No? Okay, hindi natin pinapaabot sa sobrang dumi na, ng dugyot-dugyot. Okay? And must be kept organized and well stocked. No? Okay, if in this area, okay, it must be, you have to allot, no? Okay, an area, okay, for specific material. For example, no? For your collection tube, no, this area must be allotted, no, this area for sharps container, this area for other materials, no, okay, yeah, no. Blood collection tubes, no? Okay, it comes in different sizes, okay? It can be a glass or a plastic. Na meron pa rin tayong mga glass, no? Pero common na yung mga plastic tube natin, okay? With a rubber stopper, okay? So if you remove, okay, this plastic cup, no? Okay? Merong pang isang cup no doon sa loob, which is the rubber stopper, no? Okay, it sealed the vacuum inside, no? Kasi may vacuum yun sa inside din, no? All right? And other collection tubes, no, okay, have the anticoagulants or other added chemicals, no, for different use, no, in laboratory. Okay? All right. So the rubber stoppers of blood collection tubes are color coded, no, different colors. Okay, and each type of stopper indicates a different additive or a different tube type. Okay, it has different sizes as well. Okay, this is for adult 3 to 10 ml, for pediatric 2 to 4 ml, and for the finger stick or heel stick for the neonate, no, especially for preterm. Okay, we have this small size. All right. Okay. So there is a vacuum, okay, in all collection tube. No, by the way, the generic name, okay, for this is a collection tube. Okay, the Vacutainer, okay, is a brand. Na? Okay, okay. The loss of vacuum will not fill, okay, the or it cannot, if there's a loss of vacuum, no, it cannot suck blood, no. All right. So once you open the tube, mawawala ang vacuum, no? Once you drop the tube, okay, there's a possibility na mawala ang vacuum, no? Okay, kung nawawala na sa alignment, no, yung syringe mo, okay, pwedeng mawala yung vacuum. Okay? All right, so isa-isay natin. Lavender. Okay, color lavender, okay, has an anticoagulant tube. Okay? It has an end tap, no, okay, to prevent clotting. All right? Okay, this is for hematology, okay, CBC platelet. Okay, and it should be completely filled. Now it is the amount, okay, of blood, okay, that should be collected, okay, through the tube, okay, depends on the level. No, merong maximum level, minimum, and I mean the sufficient level, okay, that you have to consider. No, merong markings naman yun dun sa gilid, no, okay, ng tube, no, kung hanggang saan mo siya pwedeng punuin. Alright? And must be inverted after filling. Okay? Pag sinabi nating inversion, inverted, that is how we mix, no? Okay, the tube. For example, this is the tube. For example, this is the tube, no? Okay? Alright? Hawakan natin siyang ganito, i-invert lang natin siya. Yan. Okay? Right? Or kaya naman yung figure of 8 method, yung paganyan, no? Ganyan. Okay? This is how we mix, no? Okay, the blood. Pag minix mo siyang ganito, okay? Or kaya naman sobrang grapal kang nagmix, okay? It will cause hemolysis. All right? Okay, and it cannot be used anymore, okay, by the laboratory. Okay? All right. Light blue, okay? Light blue, okay, is for coagulation, okay, for prothrombin time, okay, clotting time, okay, partial thromboplastin time. Yan. Okay, with sodium citrate, okay, and also, okay, you have to invert that, no? Okay, all right. The mixing, okay, or inversion, okay, of the, okay, light blue collection tube must only be 4 to 5 times, no? Okay, hanggang 4 na 5 beses lang. Otherwise, okay, magkakaroon ng clot, okay, doon sa loob. All right, green with sodium or lithium heparin, okay, for tests requiring whole blood or plasma such as ammonia, and is also used, okay, for the biomarkers, right? Red, no, okay, no additives to. For blood bank tests, no, toxicology, serology, no, okay, blood extraction, cross matching as well. Okay, the blood inside, okay, should be intended to coagulate, no? Okay, so we do not invert, okay, or we do not mix, okay, the blood, no, after filling, right? That is the red. Okay, the gray, okay, this is not common in the laboratory, hospital laboratory, okay, but in the experimental laboratory, okay, with inhibitor for glycolysis, okay, plus anticoagulant for sodium fluoride or potassium oxalate, okay, and also for the glucose levels, okay. But the yellow collection tube can also be used for glucose level or blood sugar. No? So speaking of yellow, okay, we have acid citrate dextrose additive that can be used for DNA studies, paternity studies, um, chemistry studies, and serology studies. No? Kaya pwede siyang gawin dyan. Pwedeng gamitin. Okay? Royal blue, okay, is for toxicology. Okay? It has heparin or sodium anticoagulants. Okay? The tube is designed to contain no contaminating metals. Okay? Kasi for toxicology studies. Or else, magkakaroon ng aberrant result or alteration of the result. Blood culture bottles, this is used, okay, for the blood culture, okay, to obtain the microorganism, no, okay, in the blood, okay, for the assignment of appropriate antibacterial, okay, medication, okay. Okay, for safety, the rubber stopper, okay, is positioned inside the plastic shield. No? Okay, ito yung plastic shield. When you remove this, nandun yung rubber stopper. Okay, tulad ng sinabi ko kanina. No? Alright, okay. Expiration dates, okay, can alter, okay, the potency of the additives inside. Okay, so you must not use an expired tube. Pero meron pa rin mga laboratory test na gumagamit ng expired tube and they believe na walang nangyayari doon sa result, no? Okay? Kaya sometimes yung ibang mga stand-alone laboratory clinics, no? Okay? If you are the patient, make sure tingnan nyo rin, no, yung expiration date. Alright. Okay. Collection method. Okay? We have different methods of blood sampling and collection. Okay? These two are very common, the vacuum extraction system and a needle and syringe system. Okay, vacuum extraction system is a closed system in which the patient's blood goes directly from the vein into stoppered tube without being exposed to air. Okay, so for the vacuum extraction system, okay, ito yung tinatawag natin na system. Okay, the hub, okay, or the holder, okay, the two-way needle, okay, and the collection tube. Okay? This is called a system. No? Kasi marami siya. No? Maraming consideration. Okay? Alright. The needle and syringe system, okay, is by the use of the needle, no, and syringe, okay, for blood extraction. Okay? Okay. For vacuum extraction system, okay, it is only used, okay, if the vein is prominent, pag malaki. Okay? Right? And of course, if we want to obtain large amount of specimen, all right? Okay, it is most economical and quickest and safest method to obtain specimen. Kasi compared to the needle and syringe system, okay, when we already extracted the blood, we will transfer the blood, okay, from syringe to the collection tube, no? Okay? Compare, okay, to the vacuum extraction system, we use these materials, no? Okay, this is the holder, okay, and this is the two-way needle. This is the two-way. Two-way needle. All right, okay, and the two-way needle is connected to the holder. Okay, all right. So the collection tube will be mounted or attached, no, inside. Okay, and this system will be used, no, okay, directly, okay, to puncture the site, okay, through this needle, right? So the vacuum, okay, of this collection tube will suck, no, the blood, right, until it is full, right? So if you want to obtain large amount, no, okay, we use this system kasi tatanggalin lang natin, no, yung collection tube nito, papalitan lang natin ng collection tube hanggang sa makakuha tayo. Okay, that is the advantage, no? All right. Okay, for the disadvantage, okay, it may cause small vein or fragile vein to collapse, right? The more we exert suction pressure from outside, okay, to the inside of the circumference of the vein, okay, the more the vein is prone to collapse, no? Pero hindi naman ibig sabihin na collapse sa sisira yung vein, na hindi naman. Okay? The problem with a collapsed vein, di na tayo makakapag collect ng blood, no? So insufficient na yung specimen natin. Okay? Not repositioned easily if vein and not entered immediately kasi once we unlike the syringe, okay, once we inserted this needle, okay, there is no clue, no, kung nakapasok na tayo. Okay, walang backflow. Right? Unlike the needle, may backflow tayo dun sa pinaka-hub niya. Okay? That is the reason we cannot see flash of blood. Right? So, medyo mahirap, no? Okay, mag-fish. Right? So, it is only for large vein na yung alam natin na nakapasok na tayo. Okay? Needle and syringe system, this is used for a hard to find vein, no? Uh, yung mga technique na blind shot, yan, no? Kaya yung mga malalalim na vein, yung mga maliliit na veins, gagamitan natin ng syringe yan. Kasi we can easily control, okay, the hard to get small veins and reposition the needle easily. Okay? We can also see flash of blood kay doon sa mismong hub niya. Okay? Once we inserted the needle, no, into the vein, okay, we can see flash of blood. Okay? So we can easily know, okay, if the needle is already, no, inserted into the vein. Okay? Disadvantage, okay, expensive and increased risk for accidental needle stick. Okay? All right. This is an example, okay, of a built-in protection device. No? Ito, no? Okay? Alright, so paano ginagamit yan? Yan, tulad nito. Okay? Right? After you use this syringe, okay, all you need to do is to push this towards the needle. Then malalock na siya. Okay? Ito yung mga safety device natin. Okay, ito naman, okay? You just have to move this, okay, up, no? Okay, para malock yung needle, no? No need now for us to remove the needle. Okay? Pero hindi naman na ina-advise yung removal of needle, okay, from the syringe. Okay? Okay. The gauge of the needle indicates the size of the needle and refers to the diameter of the needle's lumen or bore. The larger the gauge number, the smaller the diameter of the needle. Okay? So, and then the larger the size of the syringe, the larger the diameter of the needle. Take note of that. Okay? For phlebotomy or blood extraction, 21 to 23 gauge is recommended. 21 for routine use and 23 for smaller veins and smaller children. Okay? Okay. The needle, okay, is composed of the barrel, okay, the tip, no, yun yung magpa-puncture mismo doon sa skin, and the bevel. All right? Okay. You always have to consider the bevel up technique, no, okay, upon introducing the needle. All right? Okay, kasi kapag bevel down, okay, there is a possibility na umangat yung pasok ng needle, mag-through and through sa skin. Alright, okay. This is an example pala, no? Okay, of a two-way needle. Right? Yan. Ito, this is for the venipuncture of the skin, and this is for the connection to the collection tube. Okay? Okay. Okay. This is a butterfly needle system. Okay? It is also used, okay, to draw blood. Alright? Okay. So dito na meron din siyang holder, no? But the butterfly, okay, is different, okay, from what we use sa glutathione, no? Iba 'yon, no? May two-way needle ito, okay? Where, okay, we the needle can be in contact with the rubber stopper of the collection tube, okay? This is used, okay, for the to obtain large amount of blood, okay, for toddlers, no, okay, and pediatrics. Kasi once ma-insert na natin yan, yung needle, pag na-tape na natin siya, pwede natin iwanan, no? Tapos mag-focus na lang tayo doon sa pagkuha ng dugo. Okay? The vacuum extraction system, okay, is not advisable for children. Kasi madidislocate yun. Okay? Hindi tayo makakakuha ng blood. Right? Lancet, okay, is also a part, okay, of the materials, okay, of the tray and is used, okay, for needle stick, no, okay, or heel prick. Yeah, okay. So iba't ibang klase ng lancet natin. Tourniquet. Okay, tourniquet, okay, is used, okay, to get the vein distended, okay, for easily visualization, okay, of the vein. All right, it doesn't help the extraction, okay. It just used, okay, to distend the vein. All right. So a precaution, okay, for the use of the tourniquet, avoid leaving, okay, for more than 2 minutes yan, sorry. Avoid leaving for more than 2 minutes, okay? All right? So dapat hanggang less than 2 minutes lang or else magkakaroon ng hemoconcentration yung extraction natin. Okay? Cleaning agent, okay, we have the alcohol prep pad and betadine. Okay? 70% isopropyl alcohol is the most common. Okay? And this is more advisable, yung prep pad, strawberry cotton balls or cherry pala, cherry kay cotton balls, no? Kasi to prevent, no, the infection. Okay. Betadine swab or povidone iodine, okay, is only considered for blood culture. Okay. Soap and water, okay, is used for patient allergic to routine cleaning agents. Okay. And also, okay, if your hands and the venipuncture side, okay, is very dirty, no, with a visible and obvious sign of dirt, no, okay, kailangan natin ng soap and water. Okay, cotton balls or sterile gauze pads, okay, is only used, okay, for the close the venipuncture site, okay, as a bandage, right? Okay. Yeah, no? Okay, so aside from the cotton ball, okay, we have the OS, no? Okay, or OS, no? Or the commercially prepared bandage. Okay, gloves, no? Okay, must be worn also, okay, every time we do the procedure. Okay. Okay, in-share disposal. Marking pen, okay, for the labeling, okay, it should be black indelible marking pen. Hindi pwede yung ballpoint pen. Okay? Or sign pen na sobrang tagal matuyo. No? Kasi kapag madaanan yan ng daliri natin, okay, mag-fade, no? Okay, yung yung ink. Okay? Alright. So magdire-diretso na tayo, okay, for let's have a 10-minute break now first. Okay, para after 10-minute break, diretso na tayong collecting blood. Ito na yung consideration natin ng collection of blood. Okay? So 10 minutes muna, okay? Then we will resume. Okay, let's continue the discussion. Okay, and this time, okay, the procedures na, and considerations for collections of the blood specimen. All right. Okay. Always greet the patient, no? Okay, in a professional, friendly manner. Okay, this is how you establish your rapport and trust. Okay, it is also how you get the trust, okay, of the patient. Okay, a good initial impression will earn the patient's trust and make it easier and more pleasant to draw a good specimen. Okay, knock on the patient's door before entering, even if the door of the patient is open. All right, and this is a sign of respect as well. No, okay, and identify yourself by the name and the department. Okay, all right, you have to introduce, okay, yourself. Okay, kasi, okay, baka magulat yung pasyente, no, kung ano yung gagawin mo sa kanya. Okay, right? There are patients na takot talaga, no, okay, sa mga healthcare workers. Okay, and explain the reason, okay, for your presence. Okay, all right. The more relaxed and trusting your patient, okay, the greater the chance of a successful atraumatic venipuncture. Okay, all right. So even if you are if the patient, no, feels, okay, that you are harmless, no, okay, there will be a psychological uh, uh, factor na magaan yung magiging uh, pagtusok mo sa kanila. Yan, no? As well as a verbal, no, good verbal listening and non-verbal skills are very important for patient reassurance. No, for example, okay, you have to know, okay, if the patient is anxious, no, okay, or afraid, okay, of the procedure, okay, you can defer, okay, the procedure temporarily, okay, until the patient becomes relaxed. Okay, all right. Again, patient's identification, na-discuss natin yan kanina. This is very important. Okay. Okay, hospital, wag na yan. Okay, the perfect timing, okay, for hand washing, okay, is right after you introduce yourself and explain the procedure. Hindi yung pagpasok mo, okay, you wash your hands, na magugulat yun, no, kung sino ka, no, kung ano yung ginagawa mo. Okay, right? Okay, after you wash your hands, no, okay, apply gloves, no? Hindi ka mag-gloves ang nasa station ka pa lang, okay, or nasa kung saan ka man. Okay? All right. Patients are often reassured that proper safety measures are being followed when gloves are put on in their presence. Okay? All right, then position the patient in a comfortable position. Okay, you have to ask the patient, okay, what will be the comfortable position for him or for her. Okay, merong ibang pasyente gusto nakahiga, meron din naman iba gusto nakaupo. All right, turn the arm so that the wrist and palm face upward and the antecubital area is accessible. Okay, so parang ganito, pag nakaupo yung pasyente, naka upward, no? Okay? Yung antecubital area. Okay? All right. When supporting the patient's arm, okay, do not hyperextend the elbow. Okay? For example, no, ganito. Okay? Hindi mo i-hyperextend yan. Okay? For example, yung sa akin, baling-balik, no? Okay? Yan. Kasi when you feel it, no? Okay, when you palpate, okay, for the vein, okay, matigas, no? Okay? Kailangan freely moving, no? Okay? For example, no? You can maneuver, okay, the arm of the patient na medyo nagbebendang konti para lumambot-lambot yung muscle, okay, or yung skin doon sa mismong area. Alright? Okay, then apply the tourniquet. Okay? The tourniquet should be tight enough, okay, to stop the venous blood flow. Right? And distend the vein. Okay? Alright, the tourniquet should be applied not more than 2 minutes again. Okay? Kasi the area, okay, this area, okay, will become hemoconcentrated. Okay? Right? So magkakaroon ng alteration, okay, of the result. All right. Okay. And this is how we apply the tourniquet. It must be at least 3 inches, okay, from the site of the venipuncture. Okay. Yeah, not too tight and not too loose. Okay. After applying the tourniquet, okay, you may You may ask the patient to make a fist, okay, to further distend, okay, but make sure, okay, once you introduce the needle, okay, ask the patient to release, okay, the fist, okay, para hindi masyadong maging firm, no, okay, or matigas, no, yung extraction, okay. All right, patients often think they are helping by pumping their fist, no, kasi sometimes nagagalaw din yun pag laging uh, kapag nagka-close and feast. No? This is an acceptable practice when donating blood, but not in sample collection, as this can lead to hemoconcentration. Okay, all right. So choose the site. Okay, the median cubital vein, okay, is the most common site. Okay, if not accessible, cephalic vein, okay, or the basilic vein. Okay, if not accessible, veins on the back of the hand. Okay, the back of the hand. This is the metacarpal vein. Yan, ito. And this is actually with the first, I mean, the last, no, uh, last to be considered, no? Okay, kasi there is a possibility na magkakaroon ng collapse of the vein, no, kapag dito. Right? Okay, as much use a much smaller needle for these hand veins, no? Okay, for the metacarpal vein. All right? Okay, using a non-dominant hand routinely for palpation may be helpful, okay, when additional palpation is required immediately before performing the venipuncture. Okay, so ibig sabihin nito is, for example, hawak mo sa kanan mo yung needle, etong non-dominant hand mo, yun yung pang-palpate mo further. Okay, alright? Okay, so habang or when you are doing the fishing, no, nagsesearch ka ng vein inside, no, okay, pwede mong gamitin to, yung non-dominant hand mo, okay, to palpate further. Okay, all right. Okay, when you are when you are when you use the metacarpal vein, okay, make sure you stabilize, okay, the position of the arm. Okay, so put something here, no, a rolled linen, okay, or a pillow, okay, should support, no, okay, the hand, no, okay, of the patient. Okay. All right. Never draw, okay, from these areas. Again, okay, scarred, abraded, or inflamed skin. Arms containing IV catheters, edematous arms, occluded veins, okay, shunts, no, with shunts, yung AV fistula, okay. All right. Ang pwede lang magtusok doon kay are the hemodialysis nurses. All right. Cleansing the site using the isopropyl alcohol swab, okay, in a back and forth motion, okay, for 30 seconds with friction. Okay, guys, the traditional way, okay, to cleanse the site, no, okay, for that was taught, no, okay, to us, no, okay, during the college days, the circular movement, no, from inner to outer, okay, is not anymore recommended, no. Okay, the recommended technique now, okay, according to the Infusion Nurses Society of America, okay, is the back and forth motion, okay, for 30 seconds with friction. Okay, right, according to their studies, it's more effective, okay, to remove, no, the dirt, no, okay, and of course kill the microorganisms. All right, allow the alcohol to dry. Okay, okay, allowing the alcohol to dry can disinfect the site more, okay, than swiping or wiping again, okay, the site, no, okay, with a dry cotton. It prevents the burning sensation as well. Okay, so patients are quicker to complain about a painful venipuncture. Okay, so make sure, okay, you um, take necessary precaution. Okay, the stinging sensation caused by dry alcohol is a frequent yet easily avoided cause of complaints. Okay, all right, now after you cleanse the site, by the way guys, okay, before you cleanse the site, okay, you have to remove the tourniquet. Okay, para pumasok sa 2 minutes, no, okay, yung interval natin. Okay, you will reapply again the tourniquet kapag tutusok ka na. Okay, okay. Prepare the materials, attach the needle to the holder. Okay, this is the two-way needle or the multiple collection needle, and this is the holder. Okay, you will attach this, okay, needle, okay, to the holder. Yan, okay? And then you mount the collection tube inside. Pero hindi mo pa siya itutusok doon sa needle. Alright? Kasi mawawala yung vacuum niya. Okay? Right? Position the patient, tourniquet again the patient, position the patient, retract the skin. Okay, ito, retract the skin towards you para hindi sumama yung balat no when you puncture the skin. Right? Okay, bevel up, right? In 15 to 30 degrees. Okay? Carefully puncture the skin. All right. Okay. After you puncture the skin, okay, gently push the tube onto the needle holder, okay, so that the catheter inside the needle holder penetrates the tube. Okay, and this time, the blood flow, okay, should be visible. Right? So, yan, makikita nyo. Okay, the vacuum, okay, will suck the blood no, inside. Okay, all right. Allow tubes to fill until the vacuum is exhausted to ensure the correct blood to anticoagulant ratio. Right? So, as long as there is still a flowing or sucking blood, okay, hindi mo tatanggalin yung collection tube. All right? Okay. Now, if you do not see blood flow, okay, the tip of the needle may not yet be within the vein. Okay, you do not hit no, okay, the vein inside. Okay, or you may have already passed through the vein. Okay, nag-through and through ka, no? Okay, or you may have missed the entire vein. Ibig sabihin nun, okay, lumihis yung vein, no? Nangyayari yun. Okay? Alright? Or the vein may be pushed up against the inside wall of the vein. Okay? Yung mismong tip ng needle nandun lang sa thickness, okay, of the blood vessel. Okay? Kaya nga kapag may sclerosis, kaya yung isang vasculature, hindi na natin siya ginagamit dapat. Okay? Okay, troubleshooting. Okay? Incomplete collection or no blood is obtained, change the position of the needle, move it forward, okay? It may not be in the lumen, right? Baka hindi mo pa siya na pasok, okay? Or move it backward, okay? Baka you pass through, okay, the vein. Okay? Or kaya naman adjust the angle, okay? Baka masyadong the bevel may be against the vein wall, no? Okay, for too much angle. Or loosen the tourniquet may be obstructing the blood flow, okay? Especially if the patient is in shock, no? Hindi na nakakarating doon sa mismong site mo. Try another tube, okay? There may be no vacuum, no, in one being used. Re-anchor the vein, okay? Veins sometimes roll away from the point of the needle and puncture site. Okay, baka lumihis, no? Kaya you have to anchor the vein. Okay, other possible problems, if hematoma forms under the skin adjacent to the puncture site, release the tourniquet immediately and withdraw the needle, applying firm pressure. Okay, all right. If the blood is bright red, okay, that is arterial. Okay, so pwede ba natin gamitin yung blood? Yes, pwede naman. Kaya lang you have to consider, okay, after the removal of the needle, you have to apply pressure, okay, for more than 5 minutes kasi iba yung pressure doon compare sa vein. Okay? Now, if you are drawing more than one tube, no, okay, keep a firm grip no, in the needle holder like this one, okay, while pressing down on the patient's arm, okay, and use your other hand like this, okay, to interchange tube. Okay, so hanggat may makukuha, halimbawa 10 tube no, ang kailangan mo, okay, hanggat may makukuha kang blood specimen, okay, pwede pa yan. Alright? Okay. So meron tayong order of draw no, when we use the vacuum extraction. Okay, for example, okay, multiple collection tubes with different colors ang gagamitin natin. You have to use the you have to first collect no with a blue top, no, okay, citrated tube, right, followed by the yellow, okay, red, yan, the green, okay, and lastly, okay, the lavender. Okay, ito lang ang pinaka bottom line niya. Unang-una si blue and huling-huli si lavender. Okay, kasi pag inuna natin si lavender, okay, meron siyang anticoagulant, maapektuhan yung tube ni blue. okay, or ni light blue, okay? All right. If we collect blood, okay, from or through the syringe, no, and we transfer the blood, okay, into the collection tube, and meron tayong blood culture, okay, you have to transfer a specimen, okay, to the blood culture first before to other uh, different collection tubes, no? Kasi kailangan sterile to eh. No? Hindi naman to sterile outside. Okay? All right. So after you collected the desired amount of the specimen, okay, you have to gently release the tourniquet before the last tube of blood is filled. Okay? Remove the last tube from the needle, okay, and withdraw the needle in a single quick movement. Okay, huwag niyo nang patagalin, okay, kasi masakit yun. Okay, so right after you remove the needle, you apply pressure with a gauze or an OS. Okay, then ask the patient, okay, to apply pressure, okay, as you prepare, okay, for the labeling, no, okay, and inverting or mixing, okay, the collection tube. Okay. Right? And of course, okay, for you to prepare for the tape, no? Kapag iti-tape yun. Ayan, you can use this bandage, no? Okay, with cotton balls, no, or OS. Okay, the practice of quickly applying tape over the gauze without checking the puncture site frequently produce a hematoma. Okay, so right after the removal of the needle, you have to apply pressure. Okay, then remove the needle from the holder if appropriate, no? Okay, and discard, no, sa sharps container. All right, labeling, okay, of course, you have to label the specimen at the bedside, no? Hindi before the venipuncture or hindi sa station. Okay, kailangan doon mismo sa bedside. Okay, all right, for the syringe collection, this is, again, for small or delicate veins that may be collapsed by the vacuum of the evacuated tube system. Okay, and may also be used to collect blood culture specimen. Okay, all right, okay. So for this one, the same, no, ang procedure natin, okay, the only difference is, okay, you directly, no, extract blood, okay, from the syringe or through the syringe. Okay, all right, so right after, if you use the 3cc, no, 3cc lang makukuha mo, 5cc, 5cc lang, 10cc, hanggang 10cc lang, no, unlike sa vacuum extraction. Okay, all right, now, once you remove, okay, the syringe, okay, you have to transfer the specimen immediately into the collection tube para hindi siya mag-coagulate. All right, okay. Finger stick specimen collection, okay, a safety lancet, no, okay, which controls the depth of incision, okay, is used. No? Okay, ito, tatanggalin mo to. Right? Okay, then ipapatong mo lang ito. Wala na to, di ba? Okay, ipapatong mo lang siya doon sa skin, tapos pipindutin mo lang siya, okay, para, okay, matusok siya ng mismong needle. Right? Finger stick should not be performed on children under 1 year of age. So under 1 year of age, okay, we do the heel stick. Okay. All right. So this is how we do the finger stick. If possible, use the fourth finger, okay, or the middle finger, okay, kasi mas mabilis siyang maghilom. All right. Many patients prefer that you use fingers on their non-dominant hand, okay, para kasi pag dominant hand lagi nilang ginagamit, no? Okay, so masakit. Choose a puncture site near the right or left edge of the fingertip, okay? So, finger, okay, near the right or the left edge, okay? Hindi dun sa gitna, okay? Dito sa gilid. Alright, dito ha, sa gilid dito. Okay, yan dito. Alright, hindi sa gitna. Okay? Okay, clean the site, no, as you would for routine venipuncture, pero this time scrubbing, no? Scrubbing method na, okay? Kasi nasa tip ka ng finger. Alright? Okay, select a safety lancet appropriate for the size. Okay, you may warm the finger prior to puncture to increase the blood flow. Okay, parang mini-milk mo, no? Yan. Huh? Okay, and make the puncture perpendicular rather than parallel to the fingerprint. Okay? Right? Para hindi siya mag-clot agad. Okay, para mas marami kang makuha. Okay, wipe away the first drop of blood using gauze to remove tissue fluid contamination. Okay? Right? Yung pag na-remove mo na, okay, yung first drop of blood, saka ka lang mag obtain ng specimen. So this is how you collect the specimen, no? Okay? Isasahod mo lang siya, no? Okay? And okay, sasalok mo lang siya, okay? Usually, okay, we use the small, no? Okay, the smallest blood collection container. Okay? Yeah. Okay? Make sure bleeding has stopped, no? Apply an adhesive bandage before you leave the patient. Okay? All right. So heel stick, no? Okay, veins of small children and infants are too small for venipuncture. Okay, butterfly needles may be used, okay, to collect venous blood in older children. Okay, but if you will be having difficulty, okay, to use the butterfly, okay, just use the finger stick or the heel stick. Okay. Okay. Heel stick, no? Okay, for example, okay, this is the foot of the infant. Firmly grasp the infant's foot like this one. Okay. Of course, you do not use tourniquet. The heel may be warmed with the cloth, okay, to help increase the blood flow. Okay. And wipe the collection site with an alcohol prep pad and allow the alcohol to dry. Wipe the site with sterile cotton or gauze, okay, to be sure all alcohol has been removed. Okay. Can puncture the left, right outskirt. Okay, left or right side outskirt of the heel, not the bottom of the foot. No, okay, ito yon. No, okay. Dito lang tayo sa green, no, okay, magtutusok. Hindi dito sa mismong gitna. All right. Wipe away the first drop of blood since it may contain excess tissue fluid or alcohol, which could alter the test results. Okay. Then we collect the blood into the appropriate tube. Okay? All right. Do not squeeze the infant's foot, no? Okay, hindi it will not help, no? To it will not help the blood to flow, no, into the puncture site. Okay? Again, you will use the smallest, no, blood collection tube. Okay? So after collection is completed, apply pressure to the puncture site with a sterile gauze pad until bleeding has stopped. Okay, and do not apply an adhesive bandage to infant's foot since it may injure its delicate skin. Okay? All right. Na-discuss na pala natin itong butterfly. Okay? All right. This is how it looks okay, when you use this. Ito yung sa baba mo na. When you use okay, the butterfly vacuum extraction technique. Okay? So that is the same procedure okay, with the vacuum extraction technique. The only difference is that okay, once you inserted okay, the needle of the butterfly, okay, after taping, okay, the wings of the butterfly, you can leave, no, okay, the butterfly in place, then collect the tube here. I collect the blood here, no, okay. For the syringe butterfly naman, okay, you can also extract no, a large amount of blood, no, okay, using the syringe. That, for example, no, you've already fill, no, okay, the syringe. Pwede mo siyang tanggalin dito sa connection, and then palitan mo ng ibang syringe. Right? Okay. So that is the use of the butterfly syringe. However, this is less commonly used. Okay. So special situation, if the patient okay, it is hesitant okay, to let you collect a blood specimen, explain to them that their blood test results are very important to their care. Okay, you have to be or you have to apply okay, the patient advocacy no principle. Okay, patients have a right to refuse blood tests. No, if the patient still refuses, report and document patient's refusal. Okay, if the patient faints, no, rarely, no, okay, it can happen. Okay, but this is the most important thing to do. Okay, it is therefore important that the patients are properly seated or lying in such a way during venipuncture so that if they do faint, they won't hurt themselves. No, hindi sila babagsak. Okay. So what to do? Gently remove the tourniquet and remove the needle. call for help, and if the patient is seated, place his head between his knees. Okay? Parang ganito. Yan. Okay? Right? It can help the blood, okay, to flow into the brain. Okay? All right? And if there is a sign, okay, of uh, nausea and vomiting, you can apply cold compress on the back of the neck. It may help to revive the patient more quickly. Right? So yan lang gagawin. Okay? So there are times that unsatisfactory Dinig ba yung ulan? Sorry wait lang. Okay. So hindi sa akin yung malakas yung ulan. Ay, sorry. Sa inyo pala. Okay. Okay lang. Na-recording naman to. So, ano na lang. Isa-send na lang sa inyo recording. Okay? Kala ko sa akin yung yung maingay. Isa na. Ayan, ha? Okay? There are times that there are some unsatisfactory specimens. Okay? Alright? Pag merong mga unsatisfactory specimen, okay, they can cause misleading laboratory results. Okay? And sometimes may be rejected, okay, by the laboratory. Okay? So the patient must then undergo another venipuncture to get a better specimen. So it costs time and money to redraw, okay, the specimen. Okay, and the credibility of the laboratory is reduced if too many unsatisfactory specimens are drawn. Okay, so what are these unsatisfactory specimens? These are hemolyzed, clotted, insufficient, and mislabeled. Okay, all right. Okay, now, okay, this is an example of hemolyzed specimen. Okay, dapat kasi, okay, when this is centrifuge, after centrifuge, okay, dalawa lang ang makikita natin na color, okay, yung dark red and yung serum na parang cloudy. Yan. Okay, hemolysis means the breakup of fragile red blood cells, okay, within the specimen and the release of the hemoglobin and other substances into the plasma. So a hemolyzed specimen can be recognized after it is centrifuged by the red color of the plasma. Okay, so kung merong bright red, okay, dito sa taas, okay, that is the hemolyzed RBCs. Okay. All right, so cause of hemolysis, using too small needle for a relatively bigger vein. Okay. Pulling a syringe plunger too rapidly. Okay. So na-force yung RBCs na tumama doon sa mismong balls ng materials. Expelling blood vigorously into the tube. Shaking a tube of blood too hard. Okay, yan. Kaya hindi tayo dapat nag-i-invert lang tayo. Okay, underfilling a tube so that the ratio of anticoagulant to blood is greater than 1:9. Okay, failing to let alcohol, okay, or disinfectant dry. Using too great a vacuum. Okay, so these are the causes. Okay, all right. So hemolysis can cause falsely increased potassium, magnesium, iron, and ammonia levels, and other aberrant lab results. Okay? Alright, so kaya binabalik to, okay, ng mga medtech. Okay? Alright, clot. Now, okay, blood clots, when the coagulation factors within the plasma are activated, blood starts to clot almost immediately after it is drawn, unless it is exposed to an anticoagulant. Clots within the blood specimen, even if not visible to the naked eye, will yield inaccurate result. Okay, so causes inadequate mixing of blood. Okay, so right after, okay, we fill, okay, the collection tube by the specimen, we have to invert, okay, especially the lavender and the light blue top. Delay in expelling blood within a syringe into a collection tube is another cause. Okay, Yeah. Insufficient volume naman, okay, we did not reach, no, okay, the allowable volume, okay, needed, okay, for the collection tube. Okay, all right. Short draws will result in an inaccurate ratio of blood to anticoagulant and yield inaccurate test results. Short draws can cause by a vein collapsing during phlebotomy. Kaya habang nag-extract ka ng blood, kaya nag-collapse yung vein, wala ka nang ma-extract. The needle coming out of the vein before the collection tube is full. No? Nanginginig-nginig ka, na accidentally, nahugot mo, okay, yung needle. Loss of collection tube vacuum before the tube is full. Nangyayari yun, especially sa mga expired na at na nalaglag, no, na collection tube. Okay? All right? Okay. Wait lang, guys. Okay. So, ayos na ako. Okay, the last, no, okay, procedure, okay, is the arterial blood sampling. Okay, all right. This is very technical, no, okay, and very complicated. Okay, kasi there are unsuccessful attempts, no, okay, for the arterial blood sampling kasi mahirap siyang tusukan, no. Okay, the sample can be obtained either through a catheter placed in an artery, okay, or by using a needle and syringe to puncture an artery. These syringes are pre-heparinized and handled to minimize air exposure that will alter the blood gas volume values. Okay, all right. So the arterial blood sampling is, okay, primarily for the ABG. Okay, but also, okay, it can use also by the medtech by the laboratory, okay, for the other laboratory uh, tests, no? Okay, so the choice of site is radial artery. Okay, radial artery, okay, nandito siya, okay, located on the thumb side of the wrist. Okay, ito. Okay, right? Small in size lang to, no? Brachial or femoral artery, brachial artery is located, no, okay, at the side, okay, of the antecubital. Okay, clear? Right, femoral, of course, nandoon sa singit. Okay, all right. For initial, okay, for initial site location, okay, we should choose the radial artery, no? Kasi mababaw lang siya compare kay brachial, right? So kapag masyadong malalim, okay, more complication, okay? Kaya ang ginagamit natin is radial. All right? Okay. So the needed materials, no? Okay, first is the heparinized syringe, okay? And a syringe that is that has a very small gauge of needle. Okay. All right. Procedure. Okay. Approach the patient. Of course, you have to introduce yourself. Okay. Place the patient on their back, no, lying flat. No. This is the most common position of the patient kasi common, no. Okay. Ang fainting, no, kapag nag-arterial blood sampling tayo. Okay. Ask the nurse for assistance if the patient's position needs to be altered to make them more comfortable. Kaya para may hahawak dun sa patient kasi baka mamaya galawin niya kasi medyo masakit ito, no? If the patient is clenching their fist, holding their breath or crying, this can change breathing and thus alter the test results. Locate the radial artery by performing the Allen's test, okay, for collateral circulation. Okay? Right? If the initial test fails to locate the radial artery, repeat the test on the other hand. Once a site is identified, note anatomic landmarks to be able to find the site again. If it will be necessary to palpate the site again, put on sterile gloves. Okay? All right. Perform hand hygiene clear of a bedside work area and prepare the supplies. Okay, disinfect, no? Okay, the site. Okay? And holding the syringe like a dart, no? Ganito ang mismong paghawak natin, okay, sa syringe, dart yan, no? Okay, kung sinabi natin dart kasi ganito, di ba? Ganyan, no? Okay. Ballpen nga pa ganyan, okay? Right? Okay, so ang tusok natin pag ganito. Okay? Yan, parang ganito, no? Nakikita niyo sa picture. Okay? Alright. Holding the syringe and needle like a dart, use the index finger to locate the pulse again. Okay, use your index finger, okay, to locate the pulse again. Okay, so this will be your guide, no, kung saan may pulsation, okay, doon ka tutusok. Alright? Okay, sana ako. Inform the patient that the skin is about to be pierced. Okay, then insert the needle at a 45 degree. Okay, so this position is 45 degrees, no? Okay, yan, ito yung 90 degrees mo. Okay, ito yung 45 degrees. Okay, yan, with okay, and approximately 1 cm distal, okay, the index finger to avoid contaminating the area where the needle enters the skin. Okay, so dito mo siya itutusok, no? 1, okay, millimeter or saan ako? 1 cm pala, no? Okay, 1 cm, okay, away from the needle, away from the finger, okay, doon mo siya itutusok. Okay, hindi mo hawakan yung mismong side or hindi mo itutusok doon sa mismong under your finger. Right? Okay, so again, okay, kung saan may pulsation, okay, doon mo siya itutusok. Okay? Alright. Advance the needle into the radial artery until a blood flashback appears. No? Then allow the syringe to fill to the appropriate level. Once you've already hit, no, okay, the artery, makikita mo meron nagpupulsate na blood na pataas dun sa needle. Okay? Alright. Initially, okay, you have to retract the plunger, okay, for 0.5 cc, okay, kasi mapupuno yun ng blood, okay, once na natusok mo na yung artery. Okay, alright. Okay, then you can help the syringe, okay, you can pull the plunger, no, little by little hanggang sa makuha mo na yung desired specimen volume. Withdraw the needle and syringe and place a clean dry piece of gauze, okay, or cotton wool over the site and have the patient or an assistant apply firm pressure for sufficient time to stop the bleeding. Okay, check whether the bleeding has stopped after 2 to 3 minutes. 5 minutes or more may be needed for the patients who have high blood pressure or a bleeding disorder or taking anticoagulants. Okay, kasi mas malakas yung pressure doon sa artery compared sa vein. Okay? Alright? Okay. Expel the air bubbles, cap the syringe, and roll the specimen between the hands to gently mix it. Okay, so ganun lang yung pag-mix niya. Yan. Okay, hindi mo siya gaganitoin. Okay, ganyan lang yung pag-mix natin sa kanya. Okay? Alright? Cap the syringe to prevent contact between the arterial blood, the sample, and the air, and to prevent the leaking during transport to the laboratory. Okay? Label the same syringe, okay, with, okay, a sticker, okay, and dispose appropriately, okay, of all used material and PPE. Alright. Okay. Okay. That concludes, okay, the phlebotomy lecture. Okay. Originally, okay, for face-to-face classroom type, no, after the lecture, okay, or after every procedure, okay, magde-demo yung instructor, okay, magde-demo ako, okay, then after all of the demonstration of the procedures, okay, on the next day, okay, kayo naman yung magre-return demonstration. Okay, so this is usually, no, 2 days, no, okay, 2-day training, no, with return demonstration. Okay, all right. Okay, do you have any questions? May questions po ba? Wala ng question? Si Francis Ann, nag-raise ng hand. No? Okay, do you have any question, Francis? May question? Wala po, sir, sabi ni Frances. Okay, all right. So if you do not have any questions, okay, thank you very much, okay, for staying, okay, with my lecture. And I always say this, no? Okay, see you when the pandemic ends, no? Okay, looking forward, okay, for the uh, classroom face to face, no? Okay, face to face classroom type training. Okay, all right. So thank you very much. Okay, yes. Okay. For those who stayed, yan, thank you very much. Karen, yan, Virginia, thank you very much. Santi, 44, yan, okay, thank you very much sa inyong lahat. Okay? Sino pa ba? Okay, yan, yung mga present lang. Frances, yes, thank you. Rita, Nawada, thank you. Okay, thank you very much. Okay, so I will pass the floor, okay, to the WIPAM admin, okay, or Miss Joy, okay, for the further instruction. Okay, so thank you very much and keep safe, guys. Thank you.
Thank you so much, Sir Ruel.
Thank you, Miss Joy.
Apo. Hello guys, yung may mga kulang pa po sa mga balance, pwede nyo na pong isettle. Tapos yung hindi pa po nag-exam ng BLS and ACLS, pwede nyo na pong tapusin. Wala pong exam ang phlebotomy kasi ang exam talaga namin po dito is one-on-one, return demonstration. Yan. Tapos po, yung certificates nyo po, pwede namin pa-send po ulit nung link. Sige po, i-resend ko po ulit yung exam. Pakasend ko po ng link, pwede nyo na po itong i-save. Kasi po pag nag-live po kayo dito sa group chat, hindi nyo na po ito mababak-read. Wait lang po, send ko lang. Yan. Yung dalawa pong link, BLS and ACLS po yan, pwede nyo na pong i-save yung link. Or kung hindi nyo po talaga ma-access na, pwede po kayo mag-message sa page. Yan. Pakihintay na lang po ako ng mga certificates niyo po and IDs. Later po or early tomorrow, pag natapos pong i-review ng admin yung results po ng exam niyo. Kung meron pa po kayong questions, ma'am, sir, pwede po kayo mag-message po sa page or sa coordinator niyo po na nag-assist sa inyo po. Yan, again po sa gusto mag-avail ng hard copy ng certificates, IDs, and official receipt, pwede po kayong mag-avail. May additional fee lang po na 200 pesos. Ipadala nyo lang po ulit sa payment options na binigay sa inyo ng admin. Tapos maghintay po tayo ng 3 to 7 days. Kung outside Bicol or outside Naga City, via LBC po, free shipping na po yun. Kung hindi naman po, kung nasa Bicol or Naga City lang naman po, pwede pong pick up dito po sa office sa may Barlin. Wala na pong questions. Okay po. Again po, thank you so much po for trusting WIPAM Career Training Center. Next schedule po natin is on June 26 to 27. If you have friends po, you can refer them to us para po ma-assist namin po sila sa training schedule. Again po, thank you so much po. I'll end this Zoom na po. Thank you.